Hello, doctors. Welcome back for one more our session. This is an image session. So, for FMG 2025 students and also for Neet PG 2025 students, from microbiology, images are very, very important. You have been seeing consecutively every time there are 4 to 5 minimum images are there. And in microbiology, mostly images only. It's microscopy images, or your in a stool examination, it's images. A shape of virus, it's images. Some of the important tests, that's images. So images has important role here, so they will ask you. Okay, so what we are going to do is that you see, if you compare the maximum, there's only 50-60 standard images in micro, and questions are asked from that one. Again, those same questions, same topic. Example, diphtheria is always asked. One of the eggs frequently as is enterobius or trichuris, it could be a tinea. So these are the things frequently asked. So we are going to really revise it very, very well, so that it will be like you are going to just in exam, just by seeing the images of, you should get that confidence, this is the answer, like that. Okay, so let's start. It'll be a quick revision session for all of you who already prepared also. So let's start the topic now. So here, the first image, most of you know, you can see this is the egg. Okay, so how does the egg look like? This really looks like a dumbbell, right? Just looks like a dumbbell. If you're a little bit tilt, it will just like look like this, like a tumble. Okay, so like this, and you can see this, these are the mucus plug, the end you see, this is the mucus plug. Okay, mucus plug. So basically this looks like a dumbbell shaped egg. When you have a dumbbell shaped egg, you will know that I always say my students to remember like this: always try to break, try to break. Okay, to break is not needed. To break coconut, to try to break the coconut with what? Coconut with a dumbbell or barrel. This egg is also called barrel, or a whip. A whip is just, a whip is, the one with a long, to this bullocks and all is there. No, you beat it with the big thread, the thick one you can say. Okay, that's the whip, basically called as whip. Okay, so this is a shortcut to know. So the entire disease will be over here. So what I mean to say, try, because see, trichoris, trichuria. Okay, trichuria. Try. Because there's one more organism we're going to talk. This is called Trichinella spiralis. You not confuse with these two. Okay, here also think, but this is different. Here it is Trichinella spiralis, but here it is trichuria, right? Trichuria. So don't, there should be two try should come. So your try to break coconut. Why coconut? Because this is called, you call it as coconut cake rectum. Okay, coconut cake or shell rectum. Okay, this is the one I'm talking, this is the one you're seeing. So this is basically rectal prolapse. The rectal prolapse looks like this. The rectal prolapse looks like a coconut cake rectum. This question was asked. This also question, this egg is commonly asked. Dumbbell or barrel, because the shape, the dumbbell shape is also called as barrel shaped. Okay, barrel shaped eggs, very, very important. You'll have it. And then whip, because it is called whipworm. Other name is whipworm. Don't confuse it with your pinworm, threadworm. Pin, thread, seed, everything is your enterobius vermicularis. Whipworm is only try. So always try to break the coconut with a whip or a dumbbell or a barrel. That's it. Very, very simple. Very, very easy. So remember, this all are one. Okay, this all are one. That is which egg? Your trichuria egg. This is the egg of trichuria. That's all. Okay, egg of trichuria. What you saw. This is the first one, on the first common image. So this image or this image can come under this topic. So now somewhere, if you want to just little bit, if you feel like I've read this dumbbell somewhere else, yeah, don't forget, in your pox virus. In your pox virus also, you have dumbbells, though it is a brick shape. In pox, we're going to talk about, it's a brick shape, but you have the nucleus inside, which is looking like a dumbbell. Okay, the nucleus inside is dumbbell shape. The nucleus inside is dumbbell shape in your pox virus. Okay, that one we will revise that later. And one more thing, when we talk about a barrel, remember the barrel shaped arthrospore. It's basically the rectangular arthrospore we call. We're also going to talk about this. This barrel shape will come in your coccidiomycosis. Don't forget, it comes in your coccidiomycosis. So we're going to make a comparative study. Okay, coccidiomyces or dimorphic fungi. We're going to see. So this is the way we're going to compare. So everything is important here. Okay, get one question from here. Now, what about the Trichinella spiralis? Why I put it here? Because not to confuse with this two. The Trichinella spiralis, see, how to remember, sir? Trichomonas parvis egg is not important here, and you not even see it also. You mostly see the Trichomonas parvis favorite is your muscle. Okay, muscle. I'm going to say inside the muscle you can see spindle fibers, right? Muscle is like spindle. So muscle spindle. Okay, spin spiralis. Very simple. Muscle spindle. See, it's a spindle shape. Muscle is usually like spiral, or you can say spindle shape. So spindle like that. You remember, it's easy. So what happened here? The larva gets encysted. This is a larva encystment. Larva encystment. And very well, if you get the picture like this is your muscle, and inside you're seeing a lot of larvae getting inside the muscle. So when you see the skeletal, this is a skeletal muscle. A spindle, if you're seeing it, this one, that is Trichinella spiralis, and that's because eating the pork worm. This is because of eating the pork larva. You're eating the pork. Inside the pork you have the larva of Trichinella spiralis. So this picture, you can get this picture. Okay, very simple and easy, so no mistakes here in these two topics. Okay, yes. Now let's go next one. Next one is examiner's favorite one. This is the third one, we can say. So when you see two types of egg like this, that should be your Ascaris lumbricoides. So I'm going to write here Ascaris lumbricoides. You know that when you talk about Ascaris lumbricoides, two types of eggs. This is very important. There's only this one which has two types of egg. Rest, you don't worry about these things. Here in Ascaris lumbricoides, you have to know fertilized and unfertilized. Fertilized and unfertilized. Okay, unfertilized. Okay, very important. Okay, very important. So if you see here, this see, except Neha, I'll talk about the egg Neha in a while, but then rest all of the eggs are bile stained. Okay, so you see in a fertilized egg, you see here, you see a crescentic space here. So you see a space. So that means the space is positive. Other one is that this can float. F for float. Okay, this egg can float. Of course, both are bile stained. Both are bile stained. Okay, that is important. Bile stained. Okay, now here when you unfertilized, then you say no space. No, when you say un means no. So remember like this: no space, no float. No space, no float. Okay, examiners will definitely ask you to confuse you. You there. And Ascaris lumbricoides clinical feature is obstruction. It causes intestinal obstruction. Not much asked. Okay, so you know this one. Simple. Obstruction means it will lead to appendicitis and other symptoms. So we are in image topics. I'm not going to talk about it. Okay, that you can see through other videos if you have time. But I think for revision purpose, no need. We'll stick to this only. Okay. Yes. Now, next one, look at this image. When you see an embryo like this, you see the embryo, inside, and outside the embryo, this this is actually the eggs of Ascaris lumbricoides. I'm going to write egg. Okay, egg of Ascaris lumbricoides. Now this egg. You see embryo inside, embryo plus, you see a clear space. You see a clear space around the embryo. Clear space around the embryo. Okay, when you see this clear space around the embryo, this is very characteristic for which one? I think you guys already must have guessed. It is your hookworm. Okay, it's your hookworm. Hookworm egg. Okay, hookworm egg. And you should know what are the two hookworms. That is your I'm going to write it here. Ancylostoma, and the other one is your Necator americanus. Necator americanus. Okay, Necator americanus. So here, the frequently asked question is two important questions from the hookworm. Chandelier index, I'm not going to talk. That is your PSM topic. Chandelier more than 300 eggs, considers endemic and all. Okay, that's one thing. But in here, microbiological point of view, one frequently asked question is iron deficiency anemia, most common cause. Iron deficiency anemia, they will ask you. And other one is your larva cutaneous migrans. This one is most common cause of iron deficiency anemia, because you know that there's another one which causes your vitamin B12 deficiency. Vitamin B12 deficiency, that is the megaloblastic anemia. When you talk about the vitamin B12, it's your megaloblastic anemia. When you talk about megaloblastic anemia, the most common cause is which one? Which parasite? If you're saying Diphthobotrium latum, then you're right. Okay, that's your Diphthobotrium latum. Okay, Diphthobotrium latum. Okay, right. That's big one, big everything. I'm not talking about it now. Okay, so iron deficiency anemia means this is the hookworm, and again, this is called larva. This is actually called as subcutaneous. Okay, I'm going to write here subcutaneous. We have visceral larva migrans and subcutaneous. This is under the skin. So subcutaneous larva migrans. Subcutaneous larva migrans is also, this is a separate one. Okay, I'm not going to put it here. This is also by hookworm. Hookworm can cause us hookworm plus your strongyloides also. Plus commonly causing is strongyloides. plus strongyloides, they can give this picture. Okay, give this picture. But one thing, if the question is visceral, internal, no, visceral larva migrants, if it's visceral larva migrants, if the question is visceral larva migrants, then you know that the most common cause of visceral larva migrants is Toxocara canis. Okay, Toxocara canis. Rest all will come under all important parasites in your in nematodes will come subcutaneous larva migrants, okay, under the skin. So that's the thing. Okay, so you know that hookworm and this strongyloides stercoralis, these things all they don't go to fecal oral route. Okay, you remember how they go? They usually, I'm going to put a cross here. Okay, I'm going to put across here. So, what is this one means? Usually, why we have a subcutaneous larva migrants? Because it's because of barefoot. Okay, barefoot, not to the fecal route, barefoot. So, in barefoot, how you're going to remember? People walk barefoot where in the sand. They walk barefoot in the sand. So, remember, rest of them have different route. Other nematodes have different route of spreading, mostly fecal and few through mosquito. The three important things: SAND, sand. Okay, so S for strongyloides and cyclostoma, same thing which we talk now. Okay, strongyloides, other one is ancyclo, other one is Necator americanus. Okay, so these three to the barefoot, that also question can be asked. Okay, this is an important, that's mutually for your another revision of your this thing. Okay, so we finished the hookworm thing, and this is you can see here this egg, this one, yes, I did fourth image. This is a fifth image. Yes, doesn't matter. Image number is not important here. Now you can see this egg. This could be an again a question like eggs usually operculated, non-operculated. Okay, when you talk about the non-operculated egg, see this is an operculated egg, first operculated egg. So see here egg, you can see the lid is opened here, right? Lid is open. So we call it as operculated egg. Operculated egg means there is a lid is open, like a lid is open. Okay, there's a lid and it's open on the egg. That's all. That's called operculated egg. Okay, so what do you do? How do you remember? You know that clue. Everyone by this time must be thorough with it. An operculated egg means to do how you get an STD disease when you do open sex. That means without condom, right? So remember like that. So here operculated egg means STD. You get STD because of open sex. Okay, not without any barrier condom. So remember like that. So S stands for spirometra. Spirometra. Okay, not important egg, not frequently asked. T for all the trematodes, except your cystosoma, because sisters, you know that cystosoma, how to remember? The sisters who are working in a church, how they do, they completely cover themselves. So they're closed. That means non-operculate. They are not opened. Okay. So only these, all other trematodes. I mean, that is your clonorhynchus, fasciola, and your Westermanni, Paragonimus westermanni. Okay. D for our favorite one, Diphlebotrium latum. Just now we spoke about Diphlebotrium latum, the vitamin B12 deficiency causing thing. So this is typically, if they ask, they will ask for Diphlebotrium latum. They can ask you this thing. Okay. Or if you forget, also remember, you have to open the bottle. Bottle should be open to drink. No, the bottle should be open to drink. I mean the water, okay, not the other one. Okay, so anything, if you want to open, if you want to drink something, you have to open the bottle. So operculated egg. Okay, that's it. Very, very simple. Another easy one. Okay, you're not going to make mistake in this. Now comes the next one, and a very, very important. Frequently these days, I see the questions are asked from here. That is your cystosoma. So this is next one is your cystosoma. So cystosoma frequently asked one. Why? Because this is one reason. It is an operculated egg. We just spoke. It's a non-operculated egg. So it's completely closed. Okay, completely closed. And then three species are there. So based on the spine only, we are going to distinguish it. Okay. So this one, the first one we call it as, I'm going to write it here. This is cystosoma mansoni. I'll give you how to remember. Mansoni. This is cystosoma hematobium. Okay, the last one is cystosomia japonicum. Okay, so how did I remember? How should I remember? So very easy. Mansoni, remember Mansoni. See this girl Mansi. Okay, she's pretty girl. Happy girl. She has a dimple on her side. Okay, she has a small a mole on her side. You can remember like some mole or something, a corn on her side. Remember like that. Okay, so that means here you should remember the main feature here is spine is the spine. The spine is on the side. The spine is on the side. Okay, on the side. Here, it's on the terminal. Hematobium, it's on the terminal. So T means terminal. So terminal spine. Terminal. This question was asked recently, so you have to know, very, very important. You have to know, very important. Hematobium. Now, Japan, you can see usually they have a small nose, no small nose. When you see a small nose or knob, okay, knob, nose or a knob. See it. You can see a small knob or a nose. So that is Japanicum. Japanicum was very frequent, less asked question. So, but here important is again, when you talk about the disease, hematobium has very, very important role because it causes what cancer? Hematobium T blood. So it is affecting the bladder. It is usually in the urinary bladder. It affects, basically it's a blood, no, this is a sort of, it affects the blood vessels there, and it leads to which kinds of squamous cell, cystosoma squamous, squamous cell carcinoma. It causes squamous cell carcinoma and bladder. So in urine you will see this one. Okay, you usually identify this parasite in the urine. That's all. That's the clue. Okay, rest other two are causing GIT. We call bilharziasis, and then they cause most GIT infections. We are not going to talk about it now. Okay, that's just more a dysentery causing and all. Okay, I'm not talking about that now here. Katayama fever, many names are there for that. Katayama, bilharziasis, so many things. Okay, that you will read. I think here we're talking about image, so we're talking about important images here. So I think this cystosoma, you're not going to make a mistake. Cystosoma, it comes under again trematodes, you know very well. Okay, fine. Now the next image. Look at this image. This image is easy. You're already seeing all the cyst. So when you're seeing cyst, that becomes your hydatid cyst. So you don't expect always examiners will give you hydatid cyst. So hydatid cyst is otherwise the, what it is called, Echinococcus granulosus. Okay, we have Echinococcus multilocularis, that is looking multi-M for malignancy. It looks like a malignancy. We're not talking about here. We're talking about Echinococcus granulosus. So you see this hydatid in the liver. In liver, the most common site is head cyst. And one important point, please don't forget, here the definite host is not human. It is dog. Okay, dog is the definite host. Like for your toxoplasma, the definite host is cat. Okay, here it's dog. And for again malaria, the definite host is mosquito, anopheles, female anopheles mosquitoes. These are the three where man is not definite host. Okay, they will be used in my other lectures. Okay, this is revision part, so I'm going it a little bit quick. Okay, so this thing. So now what are things you have to remember? One test, standardly, characteristically asks your Cassoni's test. Okay, Cassoni is a type 1 hypersensitivity reaction you are going to do here. This is a frequently asked question in this part. Okay, if you ask me, you can expect this question easily. Okay, fine. Now, yes, now look at this. This is again a hydrated cyst picture. So you can see all inside the cyst form. So they can ask you to twist you, however they can ask you. Basically, if you see a cyst and then which is the test you're going to do, etc. So you can say, so this is one of your CT images where you're seeing the cyst. Okay, same thing only. That is the same thing. I'm not going to write here. Again, when it's hydrated cyst. So don't forget these things, yeah. Yeah, these are few things characteristic you're going to remember. That's all. Now, next one. Yes, now here. Yes. Inside the hydrated cyst, you know that there's procalysis, you call hydrated sand, and you see the hooklets and all those things only, not much things. So you can easily guess it and write it, not a problem. Okay, can you get it? Okay. Now, next one. Look at this egg. This is your egg of 8, and then we're going to the 9th one now. 9. This is the, very, very well. This shape, everybody must have told you, which is the egg. This is the egg of Enterobius vermicularis. Enterobius vermicularis. So in examination, you don't always expect Enterobius when usually they give, but if not also, the other name for this is called threadworm. They can give you just thread, or we call pin, or seat worm. Okay, seat worm, because it's in the buttocks region. No, so buttock region, so they can give like this, not the whip form. Whip is only to break the coconut. Try to break the coconut. Try trichoria. Okay, with the whip. That's a different story. So we're not bringing here. So now what happened? Two things should do. The child gets, it's nighttime. Okay, I'm going to write it here. Perianal itching at nighttime. The main thing is here, perinatal itching at nighttime. This is the characteristic word they'll give you. So when the child is having this perinatal itching at the night time, what the child will say, that usually the child will say two words. Either first thing it will call dada, and then it will call mama. Dada, mama, right? Dada, mama, or Mimi. Mimi, sometimes you can make Mimi, mama. Okay, why did I say? Because this is the shape of the egg. This is the shape of the egg. You can see the shape is a D shape, means the egg is just more look like a D shape, right? So then ideally it's a plano-convex. You call it as plano. The word plano-convex only will come. Okay, plano-convex egg. Okay, shape. So this is first question. And mama, because the drug of choice here, it is mebendazole, okay, not albendazole and not any other thing. So it's an exception in this. Usually you give albendazole for whole nematodes. Most of the nematodes get albendazole, but this one exception, you give mebendazole. Can be a question. Okay, so please remember this two things. Mama dada. Okay, mama dada. That's all for your egg of entropus vermiculum. The child will cry when item is having. And you know the diagnostic part, what you're going to use an NIH swab. NIH swab is the main swab we use to, or scotch tape we call. We take the perianal region, not the, you don't see it in the stool, you only in perianal region, you will see the eggs of this one. Okay, that's it. It's the egg of Entropus vermicularis. Done. Now, look at this egg. Next egg, another important egg. This is actually egg of two things. This can be an egg of, I'm going to write here, egg of your tinea. This can be your tinea egg or H. nana egg, or for H. nana, Haemophilus. Hymenolithus nana. Okay, H nana, Hymenolithus nana. So, what is important here? Here, important is these structures, what you're seeing, how to identify. When you see these hooklets inside, okay, I see, you can see 3 pairs of hooklet. 3 pairs means totally there should be 6 hooklets, okay, 6 hooklets plus a polar thickening, 2 polar thickening at 2 ends, 2 polar filaments or thickening, you can see 2 polar thickening. So this is the characteristic. And with some egg granules, you can see here all the egg granules around here. So this is the thing. So that's what even you call it as hexacanth embryo. We call it as hexacanth embryo. So this is for both your tinea and H. nana. Tinea means both your solium and saginata. And this one. Okay, that's all. So it is easy. When you see 3 pairs of hooklet and hexacanth embryo, you're thinking about the tinea or H. nana. Very, very simple. Okay, this one you're not going to make a mistake. I'm sure. I'm very sure about it. You will do it well. Next one. Next one is your, look at this one. Here, yes, this would be your 11th picture. Yes. Here, look at this picture again. This is something you can see whenever you see, usually in the history, there will be patient is having seizure, plus on CT scan, this image was seen. This is a question you will get. So you can see already, see all calcified lesions here, multiple calcified lesions here, also few. So when you see this calcified lesion, simply, when you see this calcified lesion, also you can say star in the sky, okay, starry sky appearance, whatever, okay, starry sky. You see a lot of stars in the sky, okay, like that. Anything if they give like this calcified lesion, starry sky appearance, the only thing you're going to think about is your, which one? Neurocysticercosis. Neurocysticercosis, you know, most common CNS parasite, that is Tinea solium. Tinea solium, this is basically the Tinea solium's larva is the one causing this, okay. Okay. So that's the most common. It's the most common cause of any CNS parasite. If they say, you have to think about NC. Okay, the most common cause of CNS parasite infection. CNS parasite infection. Okay, that's very important. But don't forget, okay. And usually first is always the brain is the first organ, followed by brain is your subcutaneous tissue and muscles. And muscles, skeletal muscles, they can affect any of this, but the neurocysticercosis, tinea solium, that is your pork tape form. Okay, pork tape form, that I'm not going to talk. So these are the things they can ask you. Okay, study sky and all these things can come in the question. Okay, remember that. Okay, now next one. Next one, look at this image. This image you know very well. When you see this image, you see something like this. You see, it looks very much like a flask, right? It looks like a flask. So what is this? In a GIT, when you see a flask-shaped ulcer, this is a flask-shaped ulcer. Flask-shaped ulcer, you automatically think about which one? Your entamoeba histolytica. Frequently asked question. Okay, frequently asked question. Entamoeba histolytica. Okay, very, very important one, you know. So when you talk this one, so what about in this like same in GIT, if you have a longitudinal ulcer, you know that very well. Longitudinal ulcer means it's your typhoid fever, so Salmonella typhi. And when you see a transverse ulcer, that is your tuberculosis. T for transverse, T for tuberculosis, mycobacterium tuberculosis. Very simple. In GIT, I'm talking about everything in GIT ulcers. Okay, yes, this you must study in pathology also more. That's totally fine. Now the next one. Now the next one is, look at this picture. This picture is again everyone's favorite. Again, same topic only. So I think already you must have guessed it. If you guessed, you are very good. So this is basically same. Entamoeba histolytica. Entamoeba histolytica, entamoeba histolytica. Two things. One is the cyst form. You see cyst. The cyst is quadrinucleate cyst. Quadrinucleate cyst. But the main thing is, which is the diagnostic? This is the diagnostic. The trophozoite is the diagnostic form. Trophozoite. So what do you see in the trophozoite? The most important thing what you see is you should see the RBCs inside. That's very, very important. RBC. That's what we call it as what? Erythrophagocytosis. Erythrophagocytosis. Phagocytosis. See, this trophocyte, first of all, doesn't have any shape. Shapeless. You should have a shapeless amoeboid. No, so it's nothing. You can't say it's amoeboid form, shapeless totally. And then you see an erythrophagocytes with the cartwheel like nucleus, another thing, chromatin metal, not interested. For us, you should see a red color RBC, which is called erythrophagocytosis. Then that is the definite diagnosis. That is the definite diagnosis of your entamoeba histolytica. Important question. So you can expect one question from there. Of course, the patient will be having the history of amoebic dysentery, right? Amoebic dysentery. Excuse me. Okay, now next one. Again, we're still in the same topic. This one, you know, by seeing the color of the sauce only, you can say that what it is basically the anchovy sauce. So it is called, when you see this anchovy sauce-like appearance, so you only thing you will be thinking is amoebic abscess. Amoebic abscess, most commonly seen in liver. The organism is like a liver. So in the liver, so it looks like sometimes they can give it chocolate also, chocolate sauce. So all are same, only nothing to confuse. So the idea is this is amoebic abscess. The most common cause of abscess is this one, amoebic abscess in the liver. Liver is the most common site. Okay, so don't you forget. So this also can be another question for you. Okay, so very important. So this is the 13th image. 13, and then we are going to the 14th image. Okay, now 14th image, why I put some crazy picture here? Very simple to know. You see here, you have this, and we have also giardia. So you have to know very, very careful about two things. So this is basically, I think already you must have guessed because I put it a strawberry vagina, you know. So even if you forgot also, the clue I'm going to give is here. Trichomonas vaginalis, of course. So you remember this girl Trisha, Tri. Yes, Trisha. Trisha, remember girl Trisha. So everything related with this only. First thing is that look at her. She's single. Remember that she is a single. Everything is single, single, single. About her, everything is single. I'll tell you why everything is single, single. And then you can see her. What she eats, her favorite thing to eat is strawberry. She loves a lot of strawberry, and she loves a lot of green veggies. She loves a lot of green veggies. I should write in green color. It's better. Okay, she loves green veggies so much. Okay, green veggies are a favorite. Okay, Trisha's. Second one, she's an actress, so she has all expensive things to do. What are the expensive things? Look at a beautiful diamond necklace. You see a diamond necklace here. Second one, her beauty is on an eyelash. Okay, eyelash. Her eyelash is beautiful. Her eyelash, so beautiful. Eyelash is beautiful eyelash. I don't know why I'm writing beautiful, but just for imagination. Okay. Plus, she likes to do her eyes like twitching. She likes to twitch so much. Okay. So twitching is also her favorite. Remember that. Okay. Twitching is her favorite. Okay. So I think already you know that. When now I gave the clue, you know already. Okay. So what I meant to say is that this is very important because I told single, single, single because it has only single nucleus. First of all, single nucleus. And you have only a single trophocyte. I mean to say only trophocyte, no cyst. That means she doesn't have a partner. Okay, only trophocyte, no cyst. So two important point, very important. They'll ask you, so don't you ever forget. Okay, so that's the question. This is the image exactly. This is the picture. So you can see this is the trophozoite. This is Trisha's trophozoite. I mean Trichomonas vaginalis trophozoite. No any particular name and all for this. It's just you see just single nucleus. You're seeing a single nucleus. That's all. Okay, with one nucleus. That's all. Not two nucleus like your giardia. Just with one nucleus. That's all. This is a frequently asked question. Image you get. Second one. Why did I put this picture here? This picture here. Okay, this I'm going to just cut it here so it will look better. Yeah. And then what is this one? This is a T for T. And I told twitching because twitching motility. It has a twitching motility. Important point again. Okay, motility. Okay, so trophocyte with one nucleus, and there's only trophocyte, no cyst stage. twitching motility. Okay, all are important question. So what about this, why did I put strawberry in this thing? Because in clinical future you will be having strawberry vagina, what you're seeing in the picture here down, strawberry vagina. Strawberry vagina. Now you know other strawberries. I'm not going to ask. Strawberry nose, you know that is your Rhinosporidium seaberry, right? Rhinosporidium seaberry, that is your strawberry nose. Then one is your strawberry tongue. You know, strawberry tongue is your scarlet fever and also your Kawasaki disease. Okay, so you know that that's out of our topic now. So we are going to just switching motility. We got it now. Green veggies. Why did we put green veggies? Because the discharge here, the type of discharge here it is greenish back to the vaginal discharge. The patient will have greenish, frothy, profuse vaginal discharge. Vaginal discharge. This is characteristic to distinguish it from your BV, bacterial vaginosis, which have thin, they have grayish thin discharge with clue cells, pH more than 4.5, and you put Nugent's criteria and AMSAS. We're talking about that. Candidiasis, you know, it's a curdy white cheese. Okay, so everything you should, that's what I put the word green. So Trisha's favorite is green veggies and strawberries. Don't forget, strawberry and green veggies are our favorite. And of course, why did you say diamond media and this thing? Because for the culture of the Trichomonas vaginalis, culture of Trichomonas vaginalis, you have to use diamonds media. Only few parasites have culture media. Diamond plus this lash cystine is basically the eyelash, because it's lash cystine media. Lash cystine media. Okay. And one thing not to forget, we talked about the flagella here, the trophozoite here. So in the trophozoite, remember, there is actually 5 flagellas. This is only important here. Okay, 5 flagellas. Okay, this is taken as one posterior and anterior one, 4 anterior one. Okay, so you can see here also. You can see here 4 anterior and 1 posterior, like this. Okay, so 5 flagella is there. That is also important. They can twist to confuse you. They can ask treatment, metronidazole, both the partners. Both only in Trisha and her boyfriend, both of them need treatment in this vaginal discharge diseases. Okay, it's mandatory to treat with what? Metronidazole. Okay, so okay, I can write it, not a problem. Treatment, I'm going to write metronidazole, both partners, both partners. Okay, Trisha and her boyfriend. Okay, have to get it. Okay, that's all. Very simple, easy. Now look at this. So when you go to Trichomonas vaginalis, you have to know Giardia, Lamblia. Very important. So how to remember this? Okay, first of all, I'm going to write here Giardia, Lamblia. Okay, Giardia, Lamblia. Duodenalis, whatever, Giardia duodenalis also right, Lamblia also right, however you want. Okay, sometimes called duodenalis also right. Okay. Very simple. So here you already know, I don't have to say, the picture just says you this to differentiate, because these are flagellates. Your Trichomonas vaginalis also flagellate. This is also Giardia also flagellate. So how to differentiate it? So very simple for some people, students who feel difficult, sir, I can't remember for them this one. So first of all, see, everybody hates Ghee vegetable. You know, ghee in Hindi you call ghee. This one, sort of, I don't know in Hindi what you say. So one of the vegetables. Okay, people hate it. So ghee vegetable. If people hate this guy, he hates it. So what he does with his tennis racket, he hits the gear. He hits the gear. Okay, with the tennis racket, he hits the gear. Then gear, what happened? It will fall down. It will fall down. Okay, that's all. He's hitting the gear with a fall down and it will fall down. That's all. This is very important one. Okay, rest all you know that one. And not only that, so for not only fall down, after falling down, what happened? He will go in. Now, when you give a gear vegetable to someone, to a non-vegetarian guy, definitely he's going to tear, and he is in tears. Okay, he's tearing, he's crying. Okay, so now what does it mean? Very simple. Gia, because giardia, this is giardia vegetable. Shape is called tennis racket appearance. Tennis racket appearance. Okay, question, or you also tear shape. Some people call it as tear or pear shaped also. Everything is right answer here. Okay, so that's what who cries? A person who's eating ghee vegetable, he will cry. And if a person doesn't like ghee, he hits it with a tennis racket. Very simple. Okay, fall down, you know, because repeatedly asked question, falling leaf motility. Okay, falling leaf motility. So very important. Everything is a golden point. One question, sure, you're going to get it from this point. Okay, no doubt in it. Okay, so this is how it looks like when you see the picture. They give you like this, you see it very clearly. So like this, Unlike your trichomonas vaginalis, here you see two nucleus, and you will see totally 8 flagellas, 4 pair, 8 flagella you will see, okay? 4 pairs. 4 pairs, 8 flagella. This is very, very characteristic for this one, okay? 2 nucleus and 8 flagella, 4 pairs. That's all very, very important. You know that one, okay? Yes. Now, this is the trophozoite, and this is the cyst. Cyst is just oval shaped, quadrinucleate. Sometimes by you will see 4 nucleus, or maybe by or two. Not that characteristic. Usually trophozoite is commonly asked, but if you ask also, it's very simple. It looks like this, oval shaped. Where your entomological it's round shaped, here it is oval shaped. Okay, 4 nucleus. Very, very simple. And don't you ever forget one test which you do is, I know you already know very, very well. That is your which test? Your string test. Entero test or string, we call entero or string test, where you put the capsule till which part, because the name itself gives you clue. You have giardia, there's a D, no? D, or duodenalis also name. So here the capsule should go till duodenum. The capsule will go till duodenum. Duodenum. That's all. Okay, very, very simple. Very good. So we have done with this. Now next one is your, yeah, here. Yeah, this one. Nowadays this topic is becoming popular because this is you see, why did I put this picture? Any guess? Okay, if you're saying in Hindi the bear is called Balu or Bala, okay, we can say Bala. For now we'll say Bala. So why I have to say this? Because this is a Balantidium coli. Balantidium coli. Okay, Balantidium coli. So basically what I want to say, see, first of all, this Balu, the bear, this Bala bear, what they do, they are full of hair around the body. Okay. And then what they have, they're doing this rotation. They're dancing in a rotation. They love to dance in a rotation. Very simple, right? So now when I say hair, because fully ciliated, it doesn't matter both the cyst and trophozoite, cyst plus trophozoite or ciliated. So when I say ciliated, you can see here, this is the cilia. Especially here, you can see in the cilia. All around the body, you can see the cilia. Okay, main thing. Okay, actually, the cilia is in both more and trophozoite. Cyst, it's less. Sometimes you don't see it also. Okay, so I'm writing it both, but trophozoite is statistically diagnostic part is of course your trophozoite only. So this is very important. Another important thing, both have two nucleus. Both have two nucleus. Everything is 2 2 here. It's a big, no, it's a big bala, so everything is big bala, so everything is double here. Big bala, everything is double here. That's all. That's just another way to remember. Easy. Okay, you can see here 2 2 nucleus. It's a big nucleus, small nucleus. It's a big nucleus, small nucleus. That's all. Okay, rotation, because rotation motility. Otherwise, this is very much similar to your entamoeba histolytica. Same clinical picture. Here also you have amoebic dysentery only. Only difference in the stool wet mount. There in entamoeba histolytica, you will see your trophozoite with the RBC inside. But here you will see what? Cilia around the trophozoite and 2 2 nucleus you will see. That's all. This much only. Okay, very important. Now, next. Now look at this picture. So don't get scared by seeing the next picture. What is this picture? It's a swimming pool. It looks not appropriate. No, it is just for our examination purpose to make the things very easy and you understand. So first thing you see, the girl is in this picture. What you're seeing is a Pamela Anderson. Okay, what I'm going to say is Pammy. You're seeing Pamela. I don't even know her spelling. Okay, so for us important is Pammy is important. Okay, Pame, Pamela. Okay, Pamela. This is a Pamela Anderson. She's a popular actress in US. So with her BF, what is boyfriend name? Nigel. Okay, Nigel. What happened? They were in swimming pool. You saw they are in swimming pool, and suddenly something happened and the boyfriend died. Okay, so what happened here? What is the story behind this? Very, very simple. First of all, let's start with Nigel. It's like Naegleria fowleria, right? Naegleria fowleria. His boyfriend name is Nigel, so I'm going to write here the disease name is Naegleria fowleria. Very, very simple. Very, very simple. And you have to know why I put the PAMI word, because every word here is important. You'll confuse it with acanthamoeba. So when you make it Pamela Anderson, it becomes so easy. Why? The disease what you're seeing is here progressive amoebic meningo encephalitis. So basically, you have meningitis also, encephalitis also. That's very important. You have both the terms are there. So don't make mistake in this. Okay. So when this comes, so what happened? This is very dangerous. So usually see this looks like this. This is very stylish. Just like thing. You see this stylish trophozoite. You see the stylish trophozoite. Trophozoite. Okay. Free. These are called free living amoebas. Okay. Stylish trophozoite. So where excuse. So usually I told swimming pool. Usually I told swimming pool. So from the swimming pool, inside your nasal cavity, neural spread, and cause primary meningoencephalitis. Exact word is important because you have to differentiate from that. This is style. The stylish trophozoite which you see is your this thing. So this can be a question. And usually, what? Why did you say patient died? Prognosis is very bad. Poor prognosis. One recently we had this, Karnataka outbreak happened. So you can expect this question: Naegleria fowleria trophozoite. Okay, that's it. There's a trophozoite and cyst. That's all. Now, the next one. Look at this picture. Now, this picture, you have to know these two because these are free living we call it pre-living protozoas. Okay. Now, look at this one here. So, why this I brought it here? You already know why did I put acorn. I'm going to tell you everything here about acorn story. So, it will be more easier for you. You'll remember very, very well. So, acorn. First thing about acorn. Icon, popular singer, I mean, celebrity, big celebrity. So here, for our purpose, we are going to make him as a gay. Okay, remember, as he is a gay. Okay, Gae. Okay, Gae. Okay, gay. Okay, not truly, just for our remembrance. Okay, he's a gay. So when someone is gay, what happened? You usually do a lot of hairy spikes. You keep spiky. You keep a lot of spikes on your hair. Okay, spiky hair. Hair will be spiky, spiky. And then you wear a lot of contact lens. You wear a lot of contact lens, to look hot, to look sexy. They put a lot of everyone, but then here also they'll put, okay, just for a remembrance. Okay, so Akon puts a lot of contact lens. And then what else he does? He unfortunately, he's now becoming old. You can see he has a double chin. Okay, so he got this double chin. Okay, double chin. Poor him. He got a double chin. Very simple. This much only. Okay. Now, is it you already know Akantamio? Now I'm going to say everything here. So Akantamio, the disease is Akan. Acanthamoeba. So what is the first thing? You see the trophozoite here, characteristic. Why did I say spikes? The trophozoite here, you see mud, you see lot of spikes like this. Okay, this is a characteristic feature. So you going to say here, the trophozoite, the amoeba here, it has spiky spikes around the body. First point. Okay, first point. Second one, why did I put contact lens? Because keratitis, very common in the contact lens wearer, keratitis. Okay, one more contact lens is here, Pseudomonas aeruginosa. Okay, that is theory part. I mean, I know you guys already thorough with Pseudomonas aeruginosa, or you can go through my videos I've made before. Okay, but here trophozoite spike and keratitis. Okay, next one, third one. You see, this is here the cyst. The cyst is having a double wall. Okay, that's what I said, double chin. Double chin because the cyst is double layer, double layer. That's all, double layer. Okay, so now why did I use the word GAE? Because the disease here, you call it as very, very important. What do you call it as? You call it as granulomatous, granulomatous amoebic encephalitis. GAE. So here there is no meningitis. That's what I'm stressing this. You don't see meningitis and you'll get confused in the exam. So go with this clue which I gave you. It might help you a lot. Okay. So that's it. Okay. Granulomatous. These are the points you should know. Must know. Must know. The treatment is difficult, little bit difficult. I'm not going to talk about it. Probably medicine they talk and they never ask actually that much, but doesn't matter. This you know very well. That's enough. Okay. This is a contact lens. You see the keratitis part here, double wall system. Very, very simple. No, that's all. Now, next one, we finished the 18. Now I'm going to 1919. This picture is very, 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 you know that I don't even have to say. You already know that this means very, very important because this is what? This is basically the, you call it as what? What is the other name for this parasite? We also call it as coccidian. Coccidian parasite. Coccidian parasite means they are the amoebas which is causing most common cause of, they are the most common cause of diarrhea Most common cause of diarrhea in immunocompromised patients, especially HIV or any other immunity decreased patients. Okay, leukemia patient or mostly. Okay, so these conditions common. So now look at these three things, very important. You know, you must be already knowing it, and still we revise it. It's better. The shape and size very important. The first one comes to the lowest one. This is the first one is your cryptosporidium. The most common one is cryptosporidium. Cryptosporidium. Okay, first one. This is the cyclospora, a little bit bigger than the cryptosporidium. And the last one is your cysto. Nowadays, you call isospora as cystoisospora. So please don't confuse. They are same only. Isospora, cystoisospora. Okay, they're same. Now, first thing is you have to talk about the size. Size is very important here. So first thing they will in exam, definitely they'll give you the size. 3 to 4 to 6 micron, and then it will become 8 to 12 micron, then 24 to 36. You double everything, you double it. That's all. Doubling. Okay, double doubling. Very easy. Double doubling. Okay, double doubling. And it is here, you see, it is circular. This circle here also it's circular, but cystoisospora eye is there. No, so remember an eye. If you have an eye, you can easily make like this and make a oval shape. So oval shape, oval and big like this. Okay, oval and big shape, big like this. That's it. Okay. Now also one more common thing. All are acid fast. Why? This is what stain. The stain which they given all is all this parasite acid fast parasite, all three are acid fast. That's also common thing. Okay, we call acid fast parasite also. How many percentage? We are using 1% H2SO4 in the acid fast staining. Okay, 1% also important question. Okay, 1% we are using. So now what happened? All are acid fast. We know. Now what is the important? The two important feature here is your two spora. The spora, they have one thing called autofluorescence. They can autofluorescence. They automatically glow, but that is not there in your cryptosporidium. Here there is no autofluorescence. This could be a question. No autofluorescence, immunofluorescence or fluorescence, whatever. Fluorescence. Here we don't talk about immunofluorescence, fluorescence because it's automatic. So no autofluorescence. Here in both the cases you have autofluorescence positive. That's all. This is the thing. Okay, easily you can remember. So this is the shape and little bit bigger, whatever. Okay. Now, treatment is important here and very, very important. You guys already know that whenever we talk about cryptosporidium, we talk about Nita Ambani, right? Nita Ambani. They are with the rich one, cryptocurrency people. So crypto means whenever someone is talking about cryptocurrency, automatically Nita will come. So Nita Zoxanide. Nitazoxanide is a drug of choice. But for these two, your drug of choice is cotrimoxazole. Cotrimoxazole. So expect one question from here. Cotrimoxazole. Okay. One question from your sure paka. So your revision is done with this one. Okay. Very easily you can get one question. Okay. Now next one is your next one, 20. So here you can see in this part, another very important, again, now it's more a blood parasite now. You can see very clearly, this is a monocyte. Inside the monocyte, you are seeing something. Inside the monocyte, you're seeing something a shape like this. Okay, that is basically called LD bodies. Okay, that is called LD bodies. You call it as the LD bodies, or basically it is a masticote. That's important. It's not pro-masticote, a masticote. This is a diagnostic. A masticote is a diagnostic part. Okay. So A, B. If you forget also, after A comes B. Okay. A and B. So it's easy. So don't mistake with the pro-masticote. So this is the diagnostic part. And you know which disease we're talking here? We're talking about Kala Azar. Kala Azar. So in Kala Azar is basically Leishmania donovani. Leishmania donovani. So this is a catastic finding. You know, patient has what we call it as a black fever. So black fever means patient has typical pigmentation. With pigmentation, he has splenomegaly, hepatomegaly, hyperpigmentation, catastic features. Okay. And what you see, which is the fly we're talking here? So it's very sandy. So this is called as sand fly. Another important question, sand fly. Or they can just only give this vector and say which disease is this. Okay, phlebotomus. Okay, phlebotomus. That's it. Another name is phlebotomus. Very simple. Okay, so you can have this picture also. Easy. It's an masticote means LD bodies. Okay, this. Now, so this is a typical picture of your Kala Azar. How does a Kala Azar look like? Kala Azar. This is post Kala Azar dermal leishmaniasis. Okay, this is after treatment or during the treatment course. What you get it that will be discussed clearly in your medicine. They will talk about treatment and everything. Okay, that's all. So we are done with this one. Now 21. 21, very easy one. I know that you guys must be already thorough with this. So there is this picture of Tom Cruise, right? Tom Cruise. So when I write the picture of Tom, this is Tom Cruise, right? With his girlfriend. So you know that when I say Tom Cruise, okay, you see what he's doing? He's kissing his girlfriend. First of all, I'll give all the clues. He's kissing his girlfriend. Second one, where he's from kissing, and he's from Las Vegas. No, Las Vegas. He's from Las Vegas, you know, and he's from America, Las Vegas. He's kissing his girlfriend. He's always ready to kiss, you know, he's ready to kiss everyone. He's ready to kiss everyone. Okay, Las Vegas, America. And what else? He's a muscular. Everything is big boy. He's a big. Everything is big. He's a big boy. Okay, big boy. Everything is big with him. And one more thing is that what he's a romantic guy. He's kissing and romantic. I'm going to write kissing and romantic guy. Okay, very simple. So now every pictures what you're coming here, you're going to write it. So when I say Tom Cruise, because this is the disease name is called trypanosoma. I'm going to put it right here. Okay, the disease name, you know what is it? It is a Trypanosomia cruzi. Cruzei, cruzi. Very simple. Okay, Tom Cruise is trypanosoma cruzi. And why did it say ready? The bug which is causing this is called the bug which is called redwood bug. You is ready to kiss redwood bug, or you call kissing bug. Question is asked. Okay, kissing bug. They can ask you this or that. Definite question, expected question. Okay, ready to kiss. Why did I say this? A romantic guy, because you see this sign called Romana sign, just a swelling, periorbital swelling, Romana sign. Okay, very important. Also question. Now, why did we talk about this? Is the way this is a kissing bug or the red bug. Looks ugly, but it's called kissing bug. Okay, Romana sign. Now, why did I say Las Vegas? Because the disease name is called Chagas disease. Chagas or Chagoma, whatever comes, Chagas, you'd make it as a Vegas. Vegas and Chagas looks very similar. No, easy. And the main thing why America, the disease is basically the most importantly, the disease is called as American sleeping sickness. Can be a question. American sleeping sickness. American sleeping sickness. Okay, that can be a question. Okay, all big. Why did I say because in Chagas or American sleeping sickness, everything big, I mean to say that you have three important megalies. One is your esophagomegaly, big, cardiomegaly, big, and then you will have important megacolon. Okay, this is characteristic question. Okay, that's it. Okay, now this one is over. Now next 22. Now comes the 23. Next one. Same. So when you talk trypanosoma cruzi, then we have to talk about trypanosoma brucei also. For trypanosoma brucei, for this very simple, we are going to remember only one person. That is this is your Bruce Lee, right? So this is a Bruce Lee. So you see Bruce Lee, he is going to Africa in winter. He's going to Africa in winter to meet his girlfriend, Glossy. Okay, to meet his girlfriend Glossy. That's it, very simple. To he's in Africa in winter to see his girlfriend. That's it. He's going in winter to Africa to see his girlfriend Glossy. Okay, so what I meant to say, I know you already must have guessed it, right? Okay, right. Now let's go. First of all, African sleep. Why it is African? Because African sleeping sickness. African sleeping sickness. What is the fly you're seeing here? That is name called Glossina, otherwise called CC fly. CC fly. Okay, CC. Glossina, CC fly. Okay, very important. That's the picture here. This is the winter bottom sign. I told going in winter, so it is a winter bottom sign. Winter bottom sign. Very important. Winter bottom sign. This can be a question also. Okay, that's all. This much only. For both them, the diagnosis is this. The main thing is this picture. So what is this picture you're seeing? This is simply the name itself says trypanomastigote. Okay, you see just like a like a flagella type only, very like a sort of flowing like a fish sort of thing. Okay, that is basically trypanomastigote for diagnosis. The diagnosis of your trypanosoma brucei and cruzi. Very simple. Okay, easy. You're not going to make mistake in this question now. Next, we're going to talk about this one. You must have seen this picture only. You must have already got the idea what it is. Okay, this is 24th pictures. We are going to talk about malaria now, Plasmodium. Plasmodium. That means malaria. So we already spoke about this. Here, the definite host is mosquito, female anopheles mosquito. You know very, very well. So two types of smear, thin smear, thick. Thin, see, thin, thick. So thin smear, the question was asked last year, if you remember. Thin smear is to speciate. Speciate, whether we can say it is PV or Plasmodium vivax or falciparum or ovale or malaria, whatever, you can identify it. But in thick smear, you do usually quantification. Quantification means number of parasite. How much parasite is there that you're calculating? Okay, quantification of the parasite. That's it. Now, this picture is very, very important here. So when you give the blood smear, this is a blood smear, you see multiple rings. You see rings are many. So when there is multiple rings, plus this one look like an acole. They call it as acole form. Acole is basically headphone. It's like a headphone form. So headphone or acole, multiple rings, acole, okay, and very, very important, this banana shaped, banana or crescent or banana shaped gametocyte. This, see what it is called, you already know, I know, this two, if you see this form, that is your Plasmodium falciparum. Plasmodium, the most dangerous one, falciparum. So Plasmodium falciparum, the dangerous one, especially you see what rod? Moyer's rod. Moyer's rod. See, Moyer means it's a Chinese name, no? So dangerous. Okay, so Chinese means Chinese Mao, so dangerous. Danger, no? So dangerous. So he likes banana and he has multiple rings and he has headphone or whatever you can remember. Dangerous guys, everything. Okay. Remember here, the important thing in falciparum, there is no late trophozoite and seizoid. Late trophozoite stage, you don't see late trophozoite and seizoid stage. Okay, this is also important question because these one in falciparum, what happened? They get occluded, they attach to the blood vessel and they remain in the blood vessel only. They don't come into the blood. Okay, called cytoadherence. So that's one reason. Okay, so this is for the Plasmodium falciparum. Now, next one, look at this image. So this is again very important. Now here you look here, big RBC, single, you see only single ring form, single ring. I'm going to put dash here. Okay, single ring there in previously multiple ring. Here you see only the single ring, and what else? You're seeing a gametocyte. You can see, and you're seeing the gametocyte also, oval shaped gametocyte. Okay, gametocyte, not banana shape, oval gametocyte, shaison. When you see all these things, what you remember? See, so that's what I always say. The Vivek, our boy Vivek, he is a big boy, strong boy. He always says single, but unfortunately, he has two girlfriends. Two girlfriends, what are they? One is your Duffy antigen, very, very important. The other one is a Shafna because sharpness dart. Okay, Shafna. I'm not going to write clue because you will spot it out. Okay, Duffy. So two things. This Duffy antigen is important for Vivax. It helps in this thing, and sharpness is girlfriend, another girlfriend. We have sharpness dart. Okay, sharpness dart. Remember like that. So now this oval shape becomes this all. Why did I say Vivek? Because I want to say this is your Plasmodium vivax, how it looks like. So you can have a question from there. So when you see an oval shaped gametocyte, and when you see Seijon and big RBC with only single rings, you can see only single rings. No, here you can see only single ring inside each RBC. The big RBC means this is a young RBC. We're talking about reticulocytes. Okay, so that's what Vivek is, young and big. He's young and big. Young and big, that's what he's having two girlfriend. He says he's single, he's wearing single ring, single ring or whatever, single ring. But then he's double. But then where your Moyer, when you talk about the Moyer Chinese fellow, lot of things, okay? All the dangerous things are coming. Plasmodium, okay? That's it. So we are going to, this is another one which is least asked, but please remember inside RBC, you see band-shaped gametocyte. When you see a band-shaped gametocyte, you have to simply remember Plasmodium malariae. Plasmodium malariae. Okay, malaria band. Okay, that's it. Malaria band. Mala band. Okay, Mala's band. That's it. Simple. Very less asked, but yeah, you never know. So that's what I explained that one. Okay. Now next. This one. This picture is very familiar, and I think you must have known. If you don't, also doesn't matter. What you're seeing inside the RBC, you're seeing a cross. See, beautiful cross like this. You're seeing a cross like this. This is Maltese cross. So Maltese cross. So who likes a cross? Who likes a cross? The babies like the cross. Okay, which baby? Babesiosis. Babesiosis. Babesiosis is basically similar to malaria. Only difference, you see different type of thing called Maltese cross, you see. And if you remember, babies like not only this cross, they also like what else? It's caused by which one? It's caused by which tick? Babies like to tick. So which tick? Exodid tick. Okay, hard tick. Babies like it hard, babies like it X and cross, everything looks same. See, here also you have cross, here also you have a cross. Exodid tick, basically tick tick tick. Babies likes to tick. What tick? Hard tick. That's it. Okay, so many ticks we have. Lyme's disease also, if you put the, it's also hard tick the menu. Exodid tick. And how to come tularemia you have, and also your tick will come in your endemic typhus, many places. For now, we will remember this. Okay, Maltese cross, you get a picture like this. It's babesiosis. It's also blood parasite only. Okay, blood protozoa. Okay, now this one. This is very interesting. You know this one, and these days this expected question. When you see the small, you see tachyzoids. Whatever you're seeing inside these things, these are called like this. No, whatever you're seeing this small like this, they are called tachyzoids. So how to remember, sir? How to remember? Tachy. Who is having tachycardia? Usually tachyzoids, just for remembrance. Tachycardia is common for which people? Usually physiologically for pregnant people, right? Pregnancy. So in pregnancy, which is the parasite very common because very dangerous infection, that is your toxoplasma. Exactly. So it is toxoplasma. Toxoplasma. When you see this comma-shaped tachyzoids like this, that is your Toxoplasma gondii. Toxoplasma gondii. And you know, very characteristic here. Definite host is your cat. Frequently asked question again. Like your echinococcus is also different. Here also different. Okay. It's your, it will be a cat. Not the dog, but the cat. Dog is for echinococcus hydatid cyst. Don't forget. Okay. This one question. And Sabin filament dye test you can do. Another thing, not right here, but then yeah, you'll know it. Okay. Basically. Sabin filament, toxoplasma, congenital toxoplasmosis disease and all. Okay. Same. That's all. Okay. This is all. The picture wise, these are the important things. Okay. Now, next one is your. Yes, this is your, which one? Elephantiasis. So I'm going to write it here. Elephantiasis. You know very well. Elephantiasis is caused by Usteria bronchofti. Okay, Usteria bronchofti. So single line, which is basically lymphatic system is affected. That and all you know very well. Here basically lymphatic filariasis or lymph is affected. So we call it as lymphatic filariasis. Okay, now you know this. What is the diagnostic part? Always you have to do microfilaria. What you see here is microfilaria. Here, what to remember important thing is that you in a blood, yeah, this is a night time. Usually this elephantiasis, the filaria likes to live at night time only, nocturnal habit. So if you want to bring it to daytime, the test which you're going to call DEC, that's also drug of choice for elephantiasis. If you remember, we call it as, I tell students, remember, like, you know, like this, you draw an elephant, you draw, my elephant is a little bit this thing. Okay, elephant. And remember, two persons are sitting, you and your friend, and you guys are driving in what? A nice car. Okay, remember, you're driving in a nice, beautiful car. Okay, so how to remember? Because two people, that it becomes die, and this is elephant. So ethyl. Okay, elephant, ethyl, and you have a car, carbamazine. Okay, diethyl carbamazine. That's it. That's the test. So when you do diethyl provocative test, what happen? Your microfilaria will come on the daytime. It will come on daytime. Nighttime will come into daytime. So then you will look for this microfilaria. Main thing here you have to remember is that in the tail part, in the tail of the microfilaria, there is no nucleus. Remember, that's very important. No nucleus. You see here, I don't see any nucleus. The tail part, tail end, there is no nucleus. Is characteristic for elephantiasis. Okay, but in other diseases like in your lower Brugia malai. In lova, you know that tail has many nuclei. Tail has many nuclei. Malai, there's only two nuclei. The tail end has only two nuclei. Okay, meaning the tail end. We're talking about tail end. But here in elephant, there is no nuclei. That's it. Okay. Such a big elephant. If you forgot also, sir, it's confusing how to remember. I'm just going to small picture of elephant. This much big elephant. No, this much big elephant. But look at its tail. There is no nuclei. Nothing is there. Big elephant, no nuclei. But lower, you know, it's a deer fly. It's a deer fly, no, deer fly. So like this, no, deer is like this, and then like this. Sorry for my picture. You remember? Full of dots, no? Deer has a lot of full of dots. So the dot will go to tail also. Remember like that, easy, full of tail. And in Malay, just remember two. Malay, just two. That's it. Okay. Very, very simple. You can remember like that. Okay. Fine. So this is our very, very important one. One second, I'm just continuing. Now we are going to the mycology part. Okay, very easy, so that's what I'm saying. It's very, very easy. Images, there is no mistakes in images. It's totally, not allowed to make any mistake. Okay, so remember that. Okay, now yeah, now we'll start. So here you see, now this one, by seeing the image only, I'm sure that you already know this. So first one, what is this? So see the hyphae, how it looks. They are acute angled, right? They are acute angled. You see everywhere they are acute angled. Here also you can see acute angle. Acute angle. And you see everywhere there is a septa is there. Inside you have a septa. So septate hyphae. Acute angle septate hyphae. They can give any clinical history. Usually lung history only. Lung history, the patient is having symptoms like this and all, whatever they'll give. And then skin, but doesn't matter anything. And then they give in this is an example. This is your silver stain. It's a Gomori methylamine silver stain, GMS stain. This could be anything, but usually per iodic acid chef reaction or whatever. Okay, anything, it could be anything. Hematoxin eosin stain also doesn't matter. Biopsy stain. When you have an acute angle aseptic hyphae AS, that means that is simply aspergillus. Aspergillus species. Okay, any of the aspergillus species. Okay, this can be asked, one question frequently asked. Remember that. And I'll show you mucormycosis. There's a difference between these two. This here you can see a ball which is called aspergilloma. In lungs, you can get aspergilloma, usually in an old TB cavity. In an old TB cavity, if the history gives an old TB cavity, if they give you old TB cavity, something like this appearance is there, then you think about your this thing, aspergilloma. It can be anything. For one of the exam, this question has come. Okay, so easy. So acute angle aspergillus species. Okay, this picture is very important. So these are all stains of your fungi. Because for fungi, if you want to see, okay, I'm going to write here, it's better. For fungi stain, you have lot of stains. Like one is commonly used as, KOH we do. We use the KOH, normally uses for KOH, 10% KOH, sometimes 20% for nail scraping, skin and all we use. So nail 20, but then for skin 10% we use. And we see LPCB, lactophenol cotton blue, most of these are the common ones we use. Apart from that, for capsule negative stain, and then these things, example, Gomori methylamine silver, hematoxylin and eosin, and PAS. One important thing, fluorescent stain is, remember the fluorescent stain, which is frequently asked. I think I have a picture, I'll show you. Fluorescent, calcofluor white. Calcofluor white. This can be used. That's all. Okay. So these are the important things here. Now look at this one. Now here, this makes this is the difference I want to show you now. Here, this is 27, 28. This picture is 28. I'm going to write a number so it'll be easier later also. Okay. 29. Look at this one, shapeless. You see this big one, what you see here? You see there is, first of all, it is a wide angle. It's wide angle. There is no any acute angle, wide angle. Plus, you see there is no septate, no septa. There is no septa. So wide angled hyphae with no septae means, see, W and M looks very similar, no? So you simply put what? Mucormycosis. Mucormycosis. Mucormycosis, otherwise also called as zygomycosis. Mucormycosis, same. Zygomycosis. Zygomycosis. Okay, zygomycosis. Mucorzygomycosis, very, very important. Now you know the disease. This can be a picture. Recently in COVID time, people were talking about black fungi, it's not the right term they used. So this is the picture you're getting. Okay, so this you have a severe, what you have, there is a severe vasculitis. It's very rapidly spreading. Okay, so severe vasculitis is also called rapid growers. It's a rapid grower, lid lifter, they all say they have different names for this. Because of these only, what happened, there was severe gangrene. So there the gangrene is very common because necrosis of the tissue is very common. So this is usually causes, you know, that reno orbital, orbital or ocular, reno orbital cerebral mycosis. It goes to the brain also. That's what the death was very common. Okay, the risk factors, you know very well. That also important question. Risk factors frequently they ask here. Mucormycosis risk factors are usually diabetic ketoacidosis patient. Mainly there's a condition where the iron goes high, iron chelators or iron concentrations go high. That condition happens. So it means DKA during frequent blood transfusion, steroids. These are some conditions. Steroids, even HIV patient also, they all can go, except one thing, not the antibiotic abuse, not antibiotic abuse. There's no link with that. Okay, no antibiotic use, not because of antibiotic use. This is not possible. The rest all are common. That's what I want to stress here. Okay, so very simple. So this picture, you can easily get one question. They can give any picture and then they can give identify this is the septicemia, what this is the type of hyphasine, what's your diagnosis. So wide angle no septic mucormycosis. Okay, that means can be rhizopus, mucor or absidia. We're not recommending that now. Just remember now, these are the pictures. They can ask any of this one. Okay, right. Now, next is, yes, examiner's favorite frequent. That's what I choose. All the selective topics I've choose because I know these are the things, you know, examiners will be like so eager to give you people. Okay, that's what. So one second. Fine. Okay. This one you see already the word is written crypto. So basically for cryptococcus. Cryptococcus neoform is nothing to say, you know, two things. This is a first thing. It's the most common cause of meningitis in HIV patient. Yeah, meningitis in HIV patient. And this is the only capsulated. So there are a few more, but this main thing, main in a clinically important, this is the only capsulated fungi. It's the only capsulated fungi. That is very important role. Okay, and of course, other urease positive and few important features are the melanin positive. That is for discussion. And now a picture. So when you give this picture, this is a negative stain. You see the capsule, no? So this is a negative stain. This is a negative stain for capsule. You know the negative stain Indian ink and negrosin are the two important stains we use. So background is stained, capsule is stained. Okay, you can see the capsule. Basically for capsule. This is basically for the capsule. Okay, that's one question, you know, that frequently asked. Now for us, this is another thing. They have tissue biopsy, musicarmine stain. They have given a musicarmine stain. This is more a pathological thing, but in musica stain also you can see the budding yeast cell. You can see because this is a true yeast. No, this is a true yeast. So you see the this all picture. What you're seeing is a budding yeast cell. You're seeing a true budding yeast cell. How it is looking? When you do a gram stain, that picture also they can give that also. It will be look around with a budding yeast cell like this. Okay, budding yeast cell. Like this it will look. Okay. If it is oval, then it will be candida more. If it is round, with a capsule also. With a capsule, there should be a capsule with a budding yeast cell coming out. So if you have picture like this, then that is your typical cryptococcosis. Okay, remember, very important. That can be a question. Now everything is fine. Why did I put this? Ideally, this is not the picture. This is okay. This is a rapid test, one of the rapid test, immunochromatographic test. But if they ask you the best test, the best and rapid test is which one means best and the rapid test. If they ask, it is simply the latex agglutination test. Okay, it's the latex. Important question. Latex agglutination test. Repeatedly asked question. Okay, it's like sort of now gold standard. You can say that. Latex. So here you're detecting the antigen. Antigen of cryptococcus is detected. Just the one question they can ask. Okay, that's all. Now, look at this one. So other tests, see, one of the things, this is a fluorescent stain. This is again chalcofluor white. Chalcofluor white. We can use for any fungi, So this is here you can use. So you're getting like this. It's typical. Okay, on you know. And this is very less asked question, but you never know. The selective media for cryptococcus, cryptococcus come from the PGN, right? PGN is the main risk factor for this. So PGN droplets, right? Basically, you have to say that it's the PGN's droplet. So the droplet is brown color. So that's what the idea is. Basically, you call this as bird seed agar, bird or Niger seed agar. Okay, that's important. And because in this case, let's sort of everything brown, there is melanin pigment. Because it has ability to produce the melanin pigment, you can have the color also, the colony also looks brown, something like that. Okay, so please remember, okay, these are few important things that is characteristic here. Okay, that's all. So this is for your cryptococcus frequently asked. Now, next one. Next one is again very interesting. You know it very, very well. Yes, moderated here. This picture can come any picture, again, clinical picture also, and this also they can, one second. 31. So you see the picture, you know that this is basically candidiasis. Okay, so now the topic is candidiasis, but what are the clinical features here? Candida. So this picture, if they give, this is an oral thrush. But not oral leukoplakia. I'll show you oral later. Oral leukoplakia will be for Epstein-Barr virus. Candidate is oral thrush, easily removable. You can easily remove, no problem. Easily removable. Easy to remove. Okay. But there in leukoplakia, it's difficult. It will cause bleeding. You can't remove that easily. In candida, candy can be removed easily. Remember like that. Candy removed easily. That's all. Candy removed easily. Okay. Now this is a curdy white discharge. This is a vulvovaginal. Which is very important also. Vulvovaginal candidiasis. This is one of the vaginal discharge. So one of the vaginal discharge means what you're saying here, the discharge is very curdy white, or you call it as cheesy, all as well. Cheesy discharge, cheesy vaginal discharge. Frequently asked question, that. Plus, the pH is always acidic here, more than 4.5. That is two important points when talk about the vulvovaginal candidiosis. Expected question. Okay, so they can ask this question. So this is basically the sabrodextrose agar. You can grow, even cryptococcus also grow here. So most of the fungi, they grow. The special media for fungi is this one. Sabrode, SDA we call, that is basically Sabrodes dextrose agar. And frequently asked question, the pH is almost, see, S is looking like a 5. So 5.5 to 5.6, you can say. Okay, pH is 5.5. So you see this yeast, again, yeast like fungi called as yeast like because of pseudo hyphae. Yeast like because they produce pseudo hyphae. Okay, yeast like fungi. So last time, if you remember on gram stain, yeah, and the picture is down, I'll show you. Okay, so this is yeast like, this is sabrodextrose agar. Okay, they will give you always the history, so you don't have to worry. Easily you can score it. Okay, this is a chrome agar. This many times they have asked indirectly. Chrome agar for speciation. You see different type of colors. So to know the different species, Candida, the most commonest Candida aureus. So there are many things, parapsilosis, you have the recent one, auris, so many species, glabrata, so many things are there. Okay, for that one. Okay, cruci, etc. Now, this one you see, this is a germ tube. This is an important question. Germ tube is only for Candida, germ tube. Okay, so what in a germ tube is basically the phenomenon is called Reynolds Brody phenomena. Reynolds Brody phenomena. Okay, Reynolds Brody phenomena. So what happens here is basically you are picking the Candida colony. You're mixing the Candida with the serum, patient serum. Okay, you're putting it, or plasma, doesn't matter. Both, you're fine, both will work. Candida. Okay, mixing it with the serum. Then what happened? After 4 hours, you're seeing what? You're seeing a tube like this. This is called a germ tube. That's called you'll see the germ tube. So if this is positive, it is positive only for only one species. There are a few more, but characteristically for Candida aureus, the most common one. It's positive. Rest other species are not positive. So for speciation, we can use it. You use either chrome agar or we use this one. Easy. Okay. And of course, we can use other special species identification. We have different types of other media also to grow, corn meal agar, etc., etc. But yeah, for this now, the picture, if they give like this, is a germ tube. So usually you incubate it with the plasma or the serum, mix it, and after 4 hours, you're looking for a germ tube. That's it. There's the common used one. Okay, that's all. Next, look at this. It is exactly candida. The candida, the last time the picture, the patient has some symptom and I don't know, esophagus or oral. And then on gram stain, this was seen. On gram stain, remember, gram stain, you're seeing like this oval shaped budding yeast cell. Okay, oval. It was in crypto, it was round shaped. And in crypto, it was like this. In crypto, it was round shape. Okay, this time, gram, it's oval. And please don't confuse it with the staphylococcus. Staphylococcus and all bacteria, they're smaller than this. They will be like this much only. So don't mix with this, okay? Don't mix it. That's staphylo. Now you see here, typical oval shape with some budding cells. Some places there, some places it's not. That doesn't matter. But usually, if you see any oval like this, that is candida. Okay, this is the budding yeast cell. So this question was asked. So I'm going to stress on that also. Okay, please be careful and make sure this question got right. Yes. Now, the next one, the examiner's favorite topic, next one is your dermatophytes. Dermatophytes. Three important species in dermatophytes you have to know. What are they? One is the first one. First one is, I'm going to write it here. You know that's your trichophyton. Trichophyton. Second one is your epidermophyton. I'll give you the clue how to remember. You will never forget epidermophyton. The last one is your microsporum. Microsporum. Okay, yes. Now, always remember, you have in a trichophyton, first of all, there is 3. So it means it affects the skin, hair, plus nail. Okay, question. This is a question. These species affects all the 3. In epidermophyton, skin is always there for everything. Skin plus, it ends with N, so nail. If you forgot also, very simple. Okay, microsporum, skin plus, these days everybody's hair is very micro, right? So hair, micro hair. Remember like this, micro hair. Okay, very simple. So these two, these all are questions. Now, we have usually macroconidias or the macroconidias, whatever they given or the macroconidia. The picture is given as macroconidia. I always say doctors to remember, try to write with pencil first or draw with pencil first, then go to the pen or colors. Okay, try with pencil. So here also, like we have trichuria, where you break the coconut with what? Whip or the dumbbell or barrel. There's one try. Here, this try, we are going to try with pencil. Try with pencil. So, pencil shaped. This one, what you're seeing here, you see all pencil tip or pencil shaped, you can say pencil shaped. Okay, question. This can be question. And repeatedly asked is epidermophyton. Epidermophyton, everywhere. Epi is a South Indian name. They are usually the club owners. Don't forget one club shipping spore, which you see in your Clostridium perfringens, Mr. Perfect, our Nagal's reaction. That's different story. Here also club owner. So remember, this is a club shaped. Also question. Okay. Yes. Microsporum. In microsporum, it's already the clue there. P. So look at this. It looks like a spindle. Spindle shaped. No, very easy. That's all. Okay, very easy. You know already. Now, only in trichophyton, you have microconidia. In trichophyton, you have microconidia, abundant of microconidia. Okay, plus. Rest all, no, you don't have it. Okay, very minute or no. You can simply say no. So that's also one question. If they say microconidia is abundant in epidermophyton microsporum, no. You say no, it's not there. Okay, that's all. This much only for your dermatophytes to know. Frequently asked question. Again, that means it causes all the tinea infections, the ringworm infections. So tinea solium, not tinea solium, your tinea capitis. This is tinea, tinea. That one is your parasite is tinea solium sagittate. This is tinea. So ringworm, you have tinea capitis, corporis, cruris. We have picture. I think I'll show you now. This one. Nowadays, another favorite question examiners is this one. This you can see. What is this girl's name? You can see by the picture and you can see this is Mala. Her name is Mala. Why did I say Mala? Because Mala Cecia furfur. The idea is Mala Cecia furfur. Mala Cecia furfur is the organism. She is the Mala. This girl Mala, super Mala, because of super antigen. We called her a super Mala. because Malassezia furfur is also an super antigen. Okay, and everything her favorite thing is, first of all, over her she has this hypopigmented, usually gets this derma also, hypopigmented, mildly pruritic. Okay, mildly hypopigmented rash with mild pruritus or no pruritus. Okay, pruritus. Okay, now up you see what she's eating. She's eating the meatballs plus spaghetti. Or otherwise, you can say what? Banana plus grapes. So yummy, yummy food she likes. And of course, don't forget in culture media also, for culture media, this girl, she likes fried egg also. You get fried egg colonies on adding olive oil. She likes a fried egg with olive oil. Okay, these are characteristic feature for a Malassezia furfur. Very simple. This much only. Banana plus grapes, conidias. All these are my banana grape shapes, conidias, banana shaped hyphae. The long ones are hyphae. These round ones are the conidias. That's it. Okay, conidia. Very, very simple. So you're not going to make any mistake in Malassezia furfur. Very, very easy and simple one. Okay, right. Now, next one. Look at this. Yes. Now, this is also dermatophytes. This is also dermatophytes. Now, 34, picture number 34. 34 and this is 35. Okay, very, very simple. Why did I put Sonali Bentre? Sonali Bentre. Remember Sholini, whatever you want. Okay, easy. So here, this condition, what you see, this whitey flakes, they are called favus. Favus means this white flakes which you're seeing. Okay, this white flakes which you're seeing, those are favus. Look at this condition. It looks like a ball. This is a carrion. Okay, very, very simple. So why did I put this this all are tinea capitis complications. Okay, these are tinea capitis complication. Okay, these two. Now why did I put Sonali Bentre? Because everyone's favorite in 90s, everyone's favorite is our Sonali. It's a Sonali. Okay, I'm just making Sonali Bentre. So because the causative agent is trichophyton Sean Okay, Sean or Shonali. Sounds very similar. So you remember how you want. South Indians, they can remember Shalini. Everyone's favorite is Shalini. Okay, Shalini or Shonali. She's favorite. This is favorite for everyone. Favorite. Because favus. Okay, easy to remember like that. Favorite. Easy. You'll never forget. And she had this favus. Here you see, this look like a cricket ball only. So whenever something looks like a cricket ball, carry on like a cricket ball, automatically you should think about what? Our Viru. Viru is going to help you in many places. Okay. So what I meant to say, so here it is. Sometimes Viru is mental, sometimes Viru gets crazy, that's what we call him a mental Viru we call. So trichophyton mentographites, and other one is your trichophyton verrucosum. These two are very, very important, frequently asked question. Mentographites and verrucosum. Who is causing carrier? These two. Asked question, repeatedly asked question. So you can easily remember and you're going to score that question, no doubt in it. Okay. Now, this is called Dobie's itch. Jock's itch. Dobie or Jock's itch. This is a derma question. It's okay. We can revise here, so nothing problem. So again, this is called tinea cruris here. Why we are important? Because this is tinea cruris is causing this one. 37, last one. This one, dermatophytes, last picture. This is, this is your athletic foot. Athlete's foot. So it's on the foot. So it is caused by tinea pedis. That's all. Okay. Tinea cruris and the pedis. The name is of cruris is in the inguinal region. So cruda pedis. Okay. That's all. So this is the thing. Now, the another fungi we are going. One of the subcutaneous fungi. Frequently asked question. This is what we're showing. When you see the picture only, you already must be so happy. This is a strawberry nose. This is a strawberry nose. When you see the strawberry nose, automatically you should think about what? Rhinosporidium sea berry. Okay. Sea berry. It's mostly in Tamil Nadu because of the ponds, water it comes. Basically, you're seeing polyps. Multiple polyps you're seeing, you have to do polypectomy. So when you do a smear, you see this exactly like this called spirules. You see the spirules with spores inside. Spirules with spores. That's all. This is the characteristic feature in question. Okay, that's all. Ha. Now. Next one. Next one is, so you know that strawberry nose is coming here. The woody nose, you know what is a woody nose? When you talk about woody nose, you know rhinoscleromatous. You talk about rhinoscleromatous. We're going to talk about that in a while. Rhinoscleroma. We'll talk. There's other atrophy, Oceania nose also. Rumi nose. We'll talk about it in a while. Okay. So now this is very common exam. Usually, as when you see someone is having in the leg this row of ulcers, you know what you're seeing here is a row of ulcers. You will think about what? Sporothrix shankai. Sporothrix shankai. Okay. So also called rose gardeners. Rose gardeners. Rose gardeners. You guys are very thorough with this, I know. You've studied in many places. Rose gardeners disease. Okay, rose gardeners disease. So now what happened here? First of all, it's around the lymphatics. So the first feature itself is a rose gardener. So no, because of what happened? Thorn prick. He gets the thorn prick. When he gets a thorn prick, automatically it ends in the row of ulcers. Row of ulcers. Okay, ulcers. That is totally fine. But what are other things important for a rose gardener? It's usually Himalayan region we say. So this rose gardener has some important things. Rose gardener, you have to know that he loves to smoke cigar. Okay, first thing, he smokes the cigar. He loves to smoke the cigar at night time and watch what he's watching the stars. He likes to watch the stars, and cigar, watching the star, is his favorite. And of course he works with the roses. He's working with the roses, and he has a he smokes cigar and pot also. Remember, pot also, he smokes cigar and pot. Roses, this much, no? Yes. And he has a splendor bike. He has his favorite splendor bike. That's his favorite bike. Okay, yes. Now you got already. Okay, I think you already guessed it right. You guys all. So why the cigar and pot? When you're staining, first of all, sporothrix is one thing which is coming in both. It is causing subcutaneous infection, subcutaneous fungal infection, plus it is dimorphic. Both the futures. It has both the futures dimorphic. Okay, that's what. So when you see her, when you see this as what in the yeast form, dimorphic both in yeast form, if you see here, what you're seeing here, this is basically what you're seeing is everything here, what you're going to say now. Asteroid body, important question, repeatedly asked. We see an asteroid body. The arrangement sometimes called as cigar bundle appearance, or go by cigar bundle, whatever, cigar bundle. Okay. And this phenomena is basically called Splendor Hopley phenomena. Splendor Hopley. You see in actinomyces also, but not much else. This is usually they ask here only. Splendor Hopley phenomena. This is basically the reactions you're seeing around it. It's called Splendor Hopley. Okay, it's more a pathological reaction. I am talking only from the microbiological point of view. Okay, these words are important. Cigar bundle is better. Now what you see in a hyphae form, you see what you're seeing? You're seeing the rose-like conidias. Okay, rose or flower-like conidia. Flower or rose-like conidia. That's what rose gardeners work. No, flower-like conidias. Pot. Why did we say pot? Because the treatment, the treatment for this bacteria is actually, initially they used to say potassium iodide. Iodide was used. Now, what are they using? But the best is itraconazole. Itraconazole is now the best one. Okay, treatment of choice. That's all. First, porothrix shanghai. It's very, very easy. Nothing to worry. Easily you can score. This row of ulcers along the, when I say row of ulcers along the arms, whether upper arm, lower arm, doesn't matter. Along the arms, you should see this. This is all lymphatics only. Along the lymphatics. That's important. Okay, that's all. Now, next one. Yes, this is another very important one, easy one also. You can see the picture. So what happened in this picture? I will draw a small picture to remember. This is a cave. So inside the cave, the man is trying to take his girlfriend inside the cave. This is Ohio cave. Man, he hits darling with love. Okay, with love. With love. Then what hits his darling with love. But what happened suddenly? The bat entered and gave them disease. TB disease. Caves disease, TB. That's all. Okay. So everything has a clue here. So first of all, the disease name is first of all HIT. So it is histoplasma. Now we are all talking about dimorphic fungi. We are in dimorphic. Dimorphic. Of course, sporothrix also we did. The next one now. All the dimorphics now. Histoplasma. Histoplasmosis, the disease histoplasmosis. Ohio, because Ohio disease or caves disease, we call it as Ohio disease or caves disease or darling disease. Everything is same only. Darling disease. They can ask you anything. Okay, these are all the other names. Okay, in cave he was trying to hit. And bat, because the disease is spread by the bat only, bat inside the bat. The disease is usually spread by the bat. That's all. Okay. Now, for us, those things, any dimorphic function, lung infection is a primary, and then it goes to the disseminated, immunocompromised, disseminated. Fine. Here, you see, so dimorphic two forms. So there's the yeast and the hyphae form, the mold form. So the yeast form, you will see tiny budding yeast cells, intracellular. Inside the macrophages, you can see, very, very tiny. It's like this here. Inside the cell, there is like this tiny budding yeast cells you see. Okay, this is for histoplasma. Number one, so we are talking about 40. Yeah, okay. This is on the mold form, very important. You see tuberculate conidia. Tuberculate like this, round and with shape around it. This is a tuberculate macroconidia. Tuberculate macroconidia. So tuberculate, because I told histoplasma looking like a TB. So it's another clue. TB. You can remember like the TB, tuberculate macroconidia, the disease resembling TB. Very simple. Okay. That's all. This much only. Yeah. Your noise. So I'm nothing to say. This much only. Very simple. And I know that you will do it correct in this question. Next one. Look at this. 41. Next dimorphic fungi is your this itself gives you a clue. It looks like what? Like a 8, figure of 8. So figure of 8 means this is figure of 8. So 8 looks like B, no? So this is blastomycosis. Caused by blastomyces dermatitis, blastomyces. Okay, so here what we call exactly, because the budding yeast cell, it's looking like this, we call broad-based. We call it as broad-based BB, broad-based budding yeast cell for blastomycosis. That's it. Here only the yeast form is important. The mold form is not important, so you don't need this question is expected. All in dimorphic, one question is sure. So you should know pakka, okay, without making any mistake. 42. Okay, now a clue here is cock. I put it a cock. So that itself should give you a clue. Okay, this is basically, so actually blast is otherwise called Gilchrist diseases. Okay, they shouldn't confuse with all these names, but sometimes Gilchrist, they can, crazy. Gilchrist, Chicago, North America, all the things, North American blastomycosis, everything they'll give you. Okay. Now, next is coccidiomycosis. Coccidiomyces or mycosis. Okay. Coccidiomycosis, imitate. Now, coccidiosum, you remember this cock only. Okay. Look at the cock where it's standing. It is standing. First of all, this cock's name is called Arthur's cock. Okay. This is called Arthur's cock. Okay. It's standing on the barrel. So look at, this is the one I'm saying. This is called barrel shaped. Remember, I told that barrel shaped egg is your Trichuris trichuria. Now barrel shaped arthrospore, because I told Arthur, no, this is the reason. Barrel shaped arthrospore or rectangle, we call it as rectangle also. The same only, no, because it looks like a rectangle only like this. That's what. Okay, see here, all tiny, no, they're looking like this rectangle like this. Okay, rectangular shape. Number one. Okay, this is itself is a question. Number one. Number two, you see in the yeast form, you will see what? Spherules with spores, like your rhinosporidium. Spherules with spores, you can see. Okay. So usually they'll give you this picture only. But remember, this cock, where it is going, it's walking and going where? It's traveling where? It's traveling on the valley. It's traveling on the desert valley. Okay. Desert valley. So I mean to say, when it's walking on the desert valley means the disease is called as desert rheumatism. Typical, it looks like a rheumatoid arthritis fever only. Rheumatoid arthritis, not fever, rheumatoid arthritis. Okay. Typical rheumatitis or valley fever. These are the two important questions they can ask you. So no mistakes in this question also. Okay. Desert rheumatism, valley fever, expected question. And the cock is walking on the desert and valley. Okay. Remember like that. Easy. You'll not forget. Okay. That's it. Now, next one is, yeah. Next picture. You know this one very, very well. You are thorough in this picture because of the Mickey Mouse you can see. So here you can see two important shapes. One is, this is Mickey Mouse. Here, no, you can see it looks like a Mickey Mouse. This one, it looks like a cartwheel, right? Cartwheel. So we call it as pilots or mariners cartwheel appearance. Okay. So with what happened, this Mickey Mouse in a pilot, where it's going, it is Sailing where? Parasailing to South America or Latin America. Latin America. Okay, parasailing. So what is the idea? So when I say pilot Mickey Mouse in the pilot or mariner cartwheel, okay, this is the ship. No, this is the ship. Your beautiful Mickey Mouse, it is going where? It is parasailing to, it's driving its cartwheel. Okay, with the cartwheel, it's driving and it's going to where? Latin America. So the idea is that when I say parasail, the disease name is called the disease name is called paracoccidiosis, paracoccidiosis, or we also call it as Latin America. Latin America, Latin America, South America, blastomyces. Very, very simple. Blastomycosis. So expect one question from here also. Okay, very simple and easy. So you'll not make any mistake. I know that. Now the last dimorphic, 45th one. Yes. So this is easy for South Indian or anybody who remembers our Talai Ajit. This is our this is it's Ajit. This is the actor Ajit, the superstar. So we call him as Talai. We call Talai. Okay, because this is Ajit Talai Ajit. The idea is this one is also called Thalaromyces. Initially, it used to be called as penicillium. Now we call it as Thalaromyces marnifi. Marnifi. Okay. Before it used to be called as Penicillium marnifi. Penicillium marnifi. It doesn't matter. So what do you have to remember? You have to remember that Thalais, his movie was actually how we put it this picture. I put it this picture because Thalais movie, the movie was red. The movie was red movie. It was not a good movie. It was flop, but red movie one. And the other one is C. He likes painting. So paint or broomstick, paint brush. First of all, he likes painting, and he helps his wife. So broomstick. With broomstick, he cleans his house. But sometime when the bamboo rat enters inside, he he nicely gives one back on the bamboo rat. So that also will become red color, something like that. You can remember us. Okay. So now, what I want to say, red movie, because red pigment, this is the only one that's forming with. There are few fungi that produce pigment. One is your Trichophytum rubrum also. That is not much asked. But here you see, you're seeing a red color pigment here. That's the thing. Okay, red pigment. Paintbrush or broomstick appearance. They are typical appearance. Okay, appearance. Yes, this is the one. This is the one. Broomstick like, or sometimes paintbrush, whatever you can say, fine. And bamboo shoot, because this is a reservoir. This is usually spreading from the bamboo rat. Okay. Bamboo, not bamboo shoot, bamboo rat. Okay. That's it. So this is Tale Ajit's thing. Okay. Thalassomiasis means Tale Ajit's favorite. He likes all these things. A red movie, he likes painting brush, broomstick, bamboo root, finished. Okay. Very simple. Penicillium marnifi. Yes. Now the last one. The last mycology part is this is your, now once again, 46th one. Basically, they have done a Gomori methylamine silver. Gomori methylamine silver stain. So because black color you're seeing, no? So you're seeing a black cyst and a green trophozoite. Green trophozoite. So this is a fungi, but it has name like cyst trophozoite. It looks like a parasite, means that is only one thing. That is your Pneumocystis xerovici. That is your Pneumocystis xerovici. Pneumocystis xerovici. Okay, xerovici. This is very, very important one. You know that this is common in HIV patient with CD less than 200. They're very common when CD is less than 200 or 100, but 200 is fine. Severe lung infection it causes. That's all. So this appearance, what we call here, this sometimes you call ping pong. Ping pong ball appearance, ping pong ball appearance. Okay, ping. PP. So PP, ping pong ball appearance. Very, very simple. Also, okay, pneumocystis cerevisiae in HIV patient. It's very, very common. That you remember. Okay, that's all. Next. Shapes of, now we're going to virus part. Okay, now virus is again very, very easy. So here, see, these shapes are important. This is a bullet shaped, right? It looks like a bullet. So whenever bullet you hit the rabies, rabies dog, you hit with a kill with a bullet. Otherwise, it's going to spread rabies. Just for remembrance. Okay, nothing. You shouldn't harm any animal. Just for remembrance, I'm saying. Okay, people get tended to shoot what with a bullet. So I mean to say that this is a bullet shaped. When you see a bullet shape, that is your rabies virus. Rabies virus, first thing. Second one, you see here, this one, brick with dumbbell inside, brick with dumbbell inside. Nah, I told you. So whose favorite is this? Brick is like a box. No, bricks is like a box. You make it like a pox. So pox virus. Very simple. Okay, pox. Box, you make it as a box, pox. Very simple. Okay, that's all. Now, next, you see her. This is a space vehicle. This is space vehicle. I always say, remember who is a rich singer? Adnan Swami. So adenovirus. Okay, Adnan Swami is a rich guy. So he's owning a space vehicle. Remember like that. Okay, Adnan Swami, Adnan. I'm going to write it Adnan. Okay, Adnan Swami. Singer, the singer Adnan Swami, he's rich. He has a space vehicle, his own space vehicle. Next one more cartwheel. Your cartwheel is not only for paracoccidiosis in mycology, but also in virus. So this cartwheel is very, very familiar. You know what you do. Whenever you have a cartwheel, you have to what? Rotate it. Okay, rotate the cartwheel. So rotate means you know what I'm talking. I'm talking about rotavirus. Rotavirus. Very simple and easy. You will have to remember. And next question is expected, commonly asked. Okay, now look at this. Stars. This is look like stars in the sky. A lot of stars. So stars comes, the name is already stars only. What is it? Stars. See, everything is like a star. So it's an astrovirus. Astra virus. Okay, Astra, not that significant disease yet, maybe in future. So here, look at this. This is filamentous. Filament, no, it is filamentous. So the letter which is close to F in alphabet is E. So it is Ebola. Ebola virus. Okay, Ebola virus. This is all a question. One question you can expect always. They can ask you. Okay. And the last one virus is there. I mean, in virus, no, we have few more pictures. Don't worry. This one. Let me just number. I want to see the number 6. So this is 47 is all the shapes of viruses. Very simple. This is it is very typical your COVID virus because of the petal appearance. Outside the capsid, you can see all this petal. This petal you're seeing. So that is petal-like appearance is for COVID. Even if forgot also, when COVID, lot of patients died, right? A lot of patients died in COVID. So what we did, we were putting flowers, no? We were putting lot of flower petals. Pepple. So petal shaped peploma, whatever you can say. They are for COVID. Okay. That's it. Now, next virus. Look at this one. So here you can see this all, when you see this vesicular rashes and all, you can see that is typical herpes simplex. Herpes simplex number 1. HSV1, herpes simplex 1, herpes simplex virus 1. Okay, fine. So, these are symptoms, clinical things. This is a herpes labialis. This is herpes labialis. Herpes labialis. This is your gladiatorum. You call it as herpetic gladiatorum. Yeah. And this is your dendritic ulcer. This is a typical dendritic ulcer. Okay, that's it. A geographical dendritic ulcer. All are characteristic for herpes simplex only. Very, very easy. Okay, yes. Now, look at this. This is a genital herpes, right? So, whenever there is a genital herpes, you are talking about which one? You're talking about HSV2. You know it very well. Frequently asked question. So it is very, very painful. This is a painful ulcer. There are only 2 painful genital ulcer. Painful ulcer or vesicle, multiple vesicle you can see. Okay, vesicle with multiple this thing. But of course, with this, you can know that another which is painful genital ulcer is your H. ducrei. We'll talk about it. So these are the 2 where it is painful. The ulcer is painful. Okay, one is H. ducrei and HSV2. Genital ulcers. When talk about only about genital ulcers. Okay, genital ulcer. That is your in the penis or in the vagina, anywhere. Okay, so you can guess these 2. That's all. Okay, yeah. Now, diagnosis for both HSV, see, for HSV 1, 2, and even for herpes zoster virus, you do something called, what smear you call it as? Sang smear. This is called sang smear. Sang smear, you're taking a deep tissue. When you're making a smear, you're taking from the lower part, like fully you're taking. Then only you'll get this. What you're getting here, you can see multiple cells inside. Now, see the multiple cells inside. So that is called which cell? multinucleated giant cell. You call it as multinucleated giant cell. MNGC. We call MNGC. Another important question frequently asked. Multinucleated giant cell. Important question. They can ask you. Okay. And then this is a typical. Now this is a different one. Now this is a chicken pox. Why did I say chicken pox? That is which is caused by herpes zoster virus or varicella zoster virus because of pleomorphic lesion. Okay, pleomorphic lesion. You're seeing the pleomorphic lesion. Pleomorphic lesion, different say pleomorphic centripetal. The rash starts in the central part of the body and goes periphery. That's what we call pleomorphic. Variety of lesions are at the same time. So we call it as chicken pox. Okay, chicken pox. You know this very well. Now we look at this one. When it is get reactivated, you're getting what? Shingles. This is a shingles. Unilateral, painful vesicle along the dermatomes. Okay, so if you see like this unilateral and along only single side, that is called what? This is called shingles. Yeah, shingles. So that's very important. And you know what, this one usually the treatment you give with pain, you have to give acyclovir plus everywhere for all the herpes zoster and varicella had acyclovir treatment of chest, but here it be very painful. So that's called as okay, I'm going to write it here. Okay, we give gabapentin or pregabalin. Okay, painkillers you have to give, very, very important. Okay, this is a Ramsay-Hunt syndrome. You're seeing Justin Bieber. That's basically Ramsay-Hunt syndrome. Ramsay-Hunt, again, this is due to, he had a chicken pox because of varicella zoster. Here, the complication, he got a Ramsay-Hunt syndrome. Okay, this is a seventh facial paralysis. Ram had facial, if you forgot also remember, Ram had facial paralysis. Okay, geniculate ganglion, this virus accumulate there and then, cause this changes and all. Okay, that's it. So this is a reactivated herpes zoster virus for shingles. That's all. Okay, so this is the very, very important one. And look at this again. This is a congenital varicella syndrome. Congenital varicella syndrome. Remember, if the mother gets the chicken pox and if she didn't get treatment, okay, so ideally she has to get what? Acyclovir and the immunoglobulin, never vaccine. No live vaccine to pregnant lady because chickenpox, the vaccine is called, OKA strain. Chickenpox, the vaccine name is called OKA. It's a live vaccine. So very risky for pregnant lady. Okay, it's a live vaccine. It's a live vaccine, so you don't give it this one. Okay, so you give acyclovir immunoglobulin. But suppose if she didn't take the treatment, then she'll get congenital varicella syndrome. Then the child will have all these things. So you can see this is a limb hypoplasia, typical limb hypoplasia. They can ask you question, hypoplasia. Okay, other one is the scar, the lesions you see here, they are scars. So they're called cicatricial scar lesions. That is also typical for your chickenpox. C for again chicken. We forgot also remember C for chickenpox. That's all. This is very, very, very important, frequently asked question here. Okay. Yeah. So you have to remember this very, very well because frequently questions are asked from this part. Yeah. The next one, if you see this picture, now we are going to the picture number. 1 second. Its number. So we started the chicken 48. No, this is 48. 48. Yes. Okay. This is 49 about the chicken pox. 49. Yes, this is all 49. Now this is 50. Which 50th one? So when you see this, what is the thing which you're getting? This is already not an owl eye. Some people might say this is an owl eye. Not exactly like an owl eye, but this is more a Reed-Steinberg cell. You know this Reed-Steinberg cell. So that means if you already know, we are talking about the Hodgkin's lymphoma, right? We are talking about Hodgkin's lymphoma. This is all lymphocytes, monocytes, Hodgkin lymphoma. So when you see any lymphoma, the virus which automatically comes to your mind is your Epstein-Barr virus, right? This is typical Epstein-Barr virus, EBV. Epstein-Barr virus. Okay. So when talk about Epstein-Barr virus, this is the one I'm saying. This is a oral hairy leukoplakia. Oral hairy leukoplakia. This picture comes easy, and then they'll give you clue. You don't have to worry. Sometimes it can be confused to oral thrush also, but here in the oral hairy leukoplakia, it will difficult to remove. It's difficult. It's very hairy and it's very difficult to remove. It will be very painful and can be bleeding also. Okay, that is one point you remember. That's all. Okay. Now next. Now, what are the other? Now that's the only thing for Epstein-Barr virus. This is the main thing you want. The rest all you need affects CD21 receptor. It causes multiple cancer, nasopharyngeal carcinoma, gastric carcinoma, Hodgkin, non-Hodgkin, that Burkitt's lymphoma, and you know the test, Paul-Bunel test. Yeah, one thing, yeah, that I would stress here. Please remember the test name, Paul-Bunel test, monospot or Paul-Bunel test, which is positive only for this, not for anywhere, only for Epstein, not for otherwise, not even for CMV. Paul-Bunel test or monospot test. Yeah, monospot test. That is the important thing for Epstein-Barr virus. Okay, positive. Both are positive. Now, this is typical. This one, if the picture you see only automatically, you will be saying this is a 51. Why of Kejriwal is there? XCM, but doesn't matter. So why should I write? Why is he's having owl in his body? So what is the typical owl eye inclusion body? When you see owl eye bodies, inclusion bodies, automatically you will be thinking about what? Our cytomegalovirus. So why did I put this CMV? When I say CMV, I want to say that every chief minister, Kejriwal or our Stalin or Didi, whoever, everybody have owl in their house. Plus they give pizza pie to everyone, pizza pie to all. Okay, that's it. Okay, so I'm saying one is owl inclusion body, cytomegalovirus, and other one is this is the one. The in eye retina, you know, the CMV is the most common cause of chorioretinitis or retinitis in HIV patient. And then there the appearance is called Pisa pie appearance. I think in ophthalmology they'll give you different terms and names, but here we just for this we remember this much only. Okay, this is a cytomegalovirus again. Okay, that's it. Very, very easy and simple. Yes, now this one, the next one, by seeing the disease by leg only you would have seen. So this is a type of vascular tumor, right? What you're seeing is a vascular tumor, the bluish, sort of bluish vascular tumor. When you see this type of thing, that is usually caused by which one? Which is common in the, it is the most common in the HIV patient, vascular tumor. So that is the causative agent is, that is basically Kaposi sarcoma, and Kaposi sarcoma is which? K, if you tilt it, it become like 8. So that is caused by HHV8 virus, yeah, which is also causing effusion lymphoma, other diseases, Castleman disease. But here, main thing for us, Kaposi sarcoma, vascular tumor, HIV patient. It will be like this only. Okay, very simple. Now, 53. Next one, you see any watch. This is simply just a plantar watch. But so most of the watch. When you see like this watch, the thing should come in your mind is HPV. It can be 1, 2, 3 for many types are the initial types. So you have to basically it's a HPV, human papilloma virus. Okay, human papilloma virus. Human papilloma virus. Okay, just I'm writing full name. So now here in this one, this picture, you already by seeing only you can say this is a genital watch, otherwise called as, this is basically in the, it's a penis, genital wart, or otherwise you also call it as condyloma acuminata. It is called as condyloma acuminata. Okay, this is the important thing they ask. Okay, so which is the species causing it? So condyloma acuminata is basically caused by your HPV 6 and 11. Important question. Here, one more thing, not only condyloma plus laryngeal papilloma. Laryngeal papilloma also caused by HPV 6 and 11. So both are HPV 6 and 11. Yeah, this is also same thing, the genital what? Condyloma acuminata. Okay, condyloma lata is syphilis, secondary syphilis. But this genital what you see, acuminata, HPV 6 and 11. Okay, that's what I'm writing this picture. Because you know your HPV 16, 18 and rest other things, they all are causing cervical cancer. Cervical cancer mainly. Of course, it can cause anal, vaginal cancer, etc., etc. But HPV cervical cancer. So in that one, you know, this typical cells you're seeing here called inside coilocytes. It's basically like a racins. Okay, if your racinoid appearance we call, this is very, very characteristic one. You can see. Okay, Because we have this proteins. This is typically this coagulation changes caused by protein E4 and E5. But you know that we have E6 and E7. They are the main reason for cervical cancer. E6 inhibits which one? It inhibits a P53, whereas your E7 inhibits the retinoblastoma. So these are the anti-cancer ones. So when the inhibiting anti-cancer automatically leads to the cancer. So that is important point here to be noticed. Okay, you're not going to make mistake in that. Yes. Now look at next one. Next is very interesting, and you guys must be already knowing it. 54. Yeah. So what is this picture you're seeing? When you're seeing this cheesy umbilicated, the word, it looks like a umbilicus, no? So umbilicated cheesy material comes automatically. What is the thing you're thinking? You have to think about the pox virus. Pox. Okay, pox virus. So, who is having the pox? Why did I put Peter Parker here, Spider-Man? Peter Parker, from the Peter Parker umbilicus. Let's imagine that from Peter Parker umbilicus. hmm, From the Peter Parker, some cheesy material is coming out. Let's remember like that. Okay, something is coming, cheesy material. So why I put Peter? Because the body here you see is called Henderson Peterson. At least remember Peter, so you'll make it correct. Peterson bodies or HP also sometimes we call HP bodies. Okay, doesn't matter. Henderson Peterson bodies. So don't make mistake in this one. Okay, umbilicated GC material means your pox virus in question. Okay, now next one 55. So by seeing Aishwarya Rai only you know that we are talking about parvovirus. The parvovirus. I will go very quickly because everyone is thorough with this paru. So this is a small single paru. She's a small single paru. Okay, small paru, single paru. Because in the movie Devdas or in South India Valve Mayam, there are any movie you see there it was Sri Devi. They all were single and frustrated. So because of that only frustration only what happened? She slaps the children. Paru, she slapped the children. She slaps them very badly. Okay, and as this punishment, she herself, her child is getting non-immune hydrophytalis plus sometimes aplastic crisis, sometimes pure red cell aplasia. All are questions. Okay, every word in parvovirus is important. That's what I'm stressing on this here. Small because this is the smallest virus. At that time, you see, I started looking very small. This is the smallest virus. Number one, single because this is the only single standard DNA virus. Okay, rest all are double standard. If you remember DNA virus, we're talking about the happy group. HHA, P. I'm not going to discuss all those things and all. That and all you guys know already. So here, if you see, everything is double standard. Only one P, that is your parvo. Parvo is a single standard. Okay, that question is important. The disease is called, see, she slapped with the five fingers. She's slapping it with the five fingers. So the disease name is called fifth day disease. Fifth day disease. Otherwise, you call it as the slapped cheek appearance. See this beautiful, see, it looks like a slapped. Okay, with five fingers, no? Slapped cheek appearance. Otherwise also called as erythema infectiosum. We call this erythema infectiosum. When I say infectiosum, have for five, if you forgot also. So every clue is there in that question. So please remember that. Okay, very easy. Okay, and then these are the other diseases. Non-immune hydrophytalis in the immune fetalis is RH incompatibility. The non-immune hydrophytalis, this picture, that is by parvovirus only, parvo. And then a plastic crisis in the children or children who's having sickle cell anemia. Usually in sickle cell anemia patients, it can cause this one. Pure red cell hyperplasia usually happens in the adults. Adults, it's common. Okay, pure only RBC will be affected. So these are few things you should know about the thing. And also its favorite cell is P antigen. Parvovirus likes the P antigen of RBC. You forgot P and R. That's what you have this problem. Okay. These are all our questions, repeatedly asked questions. Okay. That's it. You know now very well. One more thing. We talked about slap cheek, but then also don't forget, we have another condition called exanthema subitum. Okay. Exanthema subitum, or we call it as roseola infantum. This also, the baby looks almost similar, but remember there the causative agent is different virus. Which one? That is your human herpes virus, HHV 6 and 7. So it is 6 or 7. Okay, 6 or 7. Yes, yes. Okay. Yes, yes. Okay. So see your HHV 8 we just spoke before, that was causing the Kaposi sarcoma. This one, HHV 8. So 6 and 7 is causing this one. This also can be asked. The baby looks very much similar like this only. Baby also will have the rashes. So remember this. Okay, these are the few questions. Yes, 6, 7. Okay, so 6 and 7. Very easy. Okay, very, very simple. Now, some virus particles. So this is, you know that when you talk about Danny particle, subviral particle, this Danny means we're talking about a hepatitis B virus. Hepatitis B virus we're talking. I'm not going to talk about discuss and all. Here, only thing is that, you know, three important protein. That is based on that all diagnosis made. Yes, the surface protein, which is also called Australian antigen. Australian antigen, that is first thing. Then the core protein and the E. Okay, those are the important for diagnosis. Yes, and then E, and then C, core. Okay, based on these antigen and antibody only, we are doing the diagnostic part. So please, you learn all the diagnosis, which is acute, chronic means what, infections there, or when there is immunity, how you classify severity, which one determines those things you will be reading. You will have other points you can see. Now we are in picture, that's what. So when they give a picture like this, then I'm saying, I'm giving you clue. If they talk about S protein, core protein and all, then you think about HBV virus, hepatitis. It's called Danny particle. Danny has hepatitis B virus. Yes, in this one important thing is this one. This is a hepatitis B virus profile. So please remember carefully, in the initial incubation period, PCR is the best. Okay, in incubation period, for diagnostic purpose, PCR is best. First question. Second question, window period. In window period, which is the best means, window, if you forgot also, W, it looks like a M. So IgM of your HBC antigen, HBC antibody against HBC, IgM, HBC. It's here already mentioned here, anti-HBC IgM. So remember like this, M and W looks, that's one question. Please remember, very important. Okay. In window period, this is good. For incubation period, PCR is the best. PCR is the best in incubation period. Window period is the best. Rest all simple diagnosis, recovery, and all. You know that which one markers, and I'm not going to talk here because we are sticking only the image. Okay. So image is always important. So now we have 55. This will be a 56. 56 is the hepatitis B virus. Now we're going to 57. Next one, yeah, 57. So just they can give you this virus and tell you to identify. So when they tell you that a lot of clues are here, first of all, you're seeing what? You're seeing two RNAs, two single stranded RNAs. First clue. Second clue, you see the enzymes, reverse transcriptase is another clue. Okay. And you see the proteins, RP42 envelope protein. These are the two envelope protein. Very, very simple. No, envelope protein. So this clue all goes towards which virus? Your HIV virus. HIV virus. Okay. That you know, rest all you not to talk again. You know that is envelope protein. We have envelope gene or envelope protein. Then your pole is for the enzymes. All enzymes, pool of enzymes. You call all enzymes are derived from pole gene. Envelope gene is for the P20 and 41. And then we have GAG gene. GAG gene is just for the Lady Gaga's age is always between 17 to 24, we said. Na? So groups 17 and 24 markers. Okay. This is important. This you'll read, please. I'm not going to tell everything. Then we will take so much time. We are sticking only the picture. So when they give a virus with this you see the two single stranded RNA, then that is your HIV virus. Okay. Remember, they can ask you. Possibilities are there. Now 57, 58. Now for 58, they can give you this virus and they tell you identify which virus is this. So here, when you see so many segments, almost here 8 segments are there inside. So when you see this 8 segments, all these 8 segments, the virus which more number of segments is your which virus? Your influenza. So it is influenza virus. This is influenza virus. That is basically comes under ortho. I told you ortho guys have 6-pack, 8-pack, 8 segment. Ortho myxovirus. And they have flu. They got flu. That's what. Okay. That's it. Very, very simple. Next. Look at this. 58. No, 59. This is, look at this child. What its child is having? A parotid swelling. So parotid swelling, parotitis, pancreatitis, all this type of swelling. So parotitis. Anything big, anything big, you call mumps. Anything bumpy, that is mumps. Okay. Parotitis, orchitis, pancreatitis, organophobia. So this big swelling is Jerry. Why I say Jerry has a big, Jerry's cheek is big. Okay. Jerry Lindstein. Jerry Lynn strain for vaccine. For vaccine, MMR vaccine. The M stands for this MMR. So one is for mumps, measles mumps. So that is made by Geraldine strain. Okay, that's it for vaccine. Remember, it's a live vaccine, of course. Okay, now this one next year. Sorry, 60th one. 60th one here is, you can see rashes on the palms and sole, rashes the whole body. So this is characteristically your measles. Measles, another name, please remember, we call it as rubiola, not rubella, rubiola. Okay, totally different one. Okay, so palms and rash. So rashes on the palms and sole is very important. Only in measles and few disease like your hand, foot, mouth disease in Coxsackie you can see, and monkeypox also you can see. Okay, that's it. And of course, secondary syphilis. We'll talk about that. And the typical rash all over. But usually the rash starts behind the ear. Remember, rash starts behind the ear. In measles, rash starts behind the ear. Important. Okay. And this one you know very well. It's ideally whitish, small whitish spot. The whitish spot you know very well. By this time you must be thorough with this. Basically, it is the Koplik spot. Okay, that you know. Otherwise, it's fine. Now you learn. Okay, Koplik spot. Characteristic for your measles. Another question. Okay, and then the cells. So when you do a gym sustain and see, we are seeing what? Another multinucleated giant cell like your herpes and herpes zoster. But here we call it as Warthin Finkitley cell. Warthin Finkitley cells. Warthin Finkitley cells you call. Okay, Warthin. When forget also M and measles sounds like M is turn the M, it become W. Say, okay. So Warthin Finkitley cells. These are the characteristic pictures you should know thoroughly. Yes. Now comes the other one. This is uh, the measles picture is definitely expected question. So don't make mistake. And this look at this rash. The rashes on the you see this rash on palm where in a palate. This rash, red rash palette. So what is that called? That is basically called as for she Mers. I put a 2 capital R for Schimmer's rash. So when it's a for Schimmer rash on the palate, especially soft palate, so what is the disease coming to your mind? MMR. So only left is R. So that is your rubella. Important question. Okay. Again, so rubella has come here. And remember, rubella comes under toga viridae, rubella virus. Okay. For measles, the vaccine strain for measles, we already spoke momentum. Edmonston Jagrib, Edmonston Jagarib. People say Garib, Garib means poor. So poor people will take measles vaccine, like that. Okay. Yes. For rubella, the name, it starts with a letter only. RA 27 bar 3. Okay. RA. That's it, the vaccine. This is the vaccine for rubella. So all of them make the MMR vaccine. Okay. That's all. Now, yes, this is another thing in rubella. Congenital rubella syndrome is frequently asked questions. Now, what you do, this is a congenital rubella syndrome. The shortcut is when the poor mother gets a congenital rubella syndrome and a child like this, what do? You take the mother to which place? CCD. You take her to CCD and buy her what? CCD and buy a blueberry muffin. Okay, blueberry muffin. Poor her. She must be so worried. So you have to do these three things. Okay. Just for remembrance only. Okay. Okay. So C for cataract, very well, cataract. And another C is for cardiac problem. Cardiac problem, the disease is simply patent ductus arteriosus. P and R look similar. So rubella, P, patent ductus arteriosus. Okay. After P, Q, R, no. So P, R looks very similar. That's what. Okay. And then D for deafness. Sensorineural deafness. Okay. This is a triad, classic triad. Okay. With the blueberry lesion, the rash will be blueberry rash. You will have blueberry rash. That's what. Okay. Blueberry rash. Very simple and easy. Nothing to too much to worry. It's very, very easy. Okay, micro, you will do very well. Pictures me, you will not make any mistake. I'm sure. Very, very sure. Okay, now look at this one. This is another very different one. Usually comes because of the dog bite. So this is what you're seeing here. These are the cells. These are the brain neurons, especially Purkinje cells in neurons. Purkinje cell, you see inside the Purkinje cells. So you see, this is a special stain which we used called cellular stain. Cellular stain, okay? So you will sell the which dog? Rabies dog. So you will sell the rabies dog. Remember like that. You will sell the rabies dog. Sell the rabies dog. So this is special stain important. Sell the rabies dog. So what is the thing you're seeing inside the name of this, the one which you call negri bodies? Yes, you look for negri. Negri bodies. Negri bodies means unit for rabies, rabies, rabies. The bullet shaped virus. Okay, that's it. Very, very simple. So this for the rabies. Okay, negri bodies inside the neuron. You can see here also. You can see here this mild stained one. Here also you can see this mild stained one. All these things. Okay, special bodies. Of course, the diagnosis of the rabies, for the main gold standard test for diagnosis of rabies is, repeatedly I'm saying, direct fluorescent antibody test. Direct fluorescent antibody test. Okay, we are detecting the antigen, but we are using the fluorescent tagged antibody. That's all. Okay, very simple. Yes. So now this one, this is a sort of, you see in the cubital fossa, if the example you do which test? Tourniquet test. Tourniquet test. You put a tourniquet and check the cubital fossa. If there's more than 20 rash petechia per cubic place. So this will be called as what? This will be which positive? This will be dengue. That is DHF, dengue hemorrhagic fever positive. Yeah, of course, platelets are going low in the dengue. You know that one. Okay. And one more thing, always say, please remember antibody dependent enhancement. That is, if one virus, first dengue virus comes first time, second time when the second dengue 2 comes, instead of first one protecting, it will aggravate. That leads to dengue hemorrhagic fever. That's called antibody dependent enhancement. That ADE, please remember, important. You will have a question. Again, this is picture, so I'm not going to talk about that there. Okay. So the next picture. Look at this one. So you're seeing a beautiful steeple, like a steeple you're seeing. Okay. So when you see a steeple sign, what do you remember? Steeple sign means you'll think about the steeple. No, steeple is like a mandir, right? It's like a beautiful, some church, this thing or mandir. So who loves to sit in the steeple and meditate? Our Paramamsa. Parama Hamsa, the god, right? So the virus name is simply para-influenza virus. That's it. Para-influenza virus. Paramahamsa sit there quietly and he meditates under the steeple, in the steeple. So para-influenza virus, and what is the disease it's causing? Usually meditate in the crop, no? Crop, the field, green field with crop. So croup. That is basically acute laryngotracheobronchitis, right? This is the important one. So steeple sign is frequently asked radiological question from micro point of view. And of course, we have epiglottitis. We are going there in a while. So this is a, please remember, steeple sign, para-influenza. Paramahamsa meditates in the steeple. Remember like that. So you can remember. Yes, next one. 65. This is this is genital. It can be anything, but now we are talking about the syphilis. Okay, we are writing syphilis. Syphilis means you know that the causative agent is Treponema pallidum. Treponema pallidum. You know, it's a spirochetes. Pallidum. It looks like this, na? Spirochetes. We are talking about one of the spirochetes. So here you see this is a hard chancre. It can be any chancre. You can't, it can be any ulcer, but because it's syphilis, we know less. See, less means less pain. Less pain means no pain. There is no pain. It's a hard chancre, but no pain. That's all I want to say. Okay, hard chancre or ulcer. It is there, but there is no pain. This is a primary syphilis. This is a primary. Hmm. This is a primary syphilis. Whereas this next picture, what you're seeing is a secondary syphilis. In secondary syphilis, you can see rashes on the palms and soles. See rashes on the palms and soles, one thing. And then what you see, this is a condyloma lata. This is one, just not acuminata. Acuminata you've seen in the pox fire, your HPV, sorry, HPV. Here it is condyloma lata, just the lata. Okay, so secondary. And then this is your tertiary. Tertiary syphilis, mostly you go with the gummas. You'll see a lot of gummas, right? Gummas. Gummas, and of course, iotitis and neurosyphilis are common. Right, that also neurosyphilis. And of course, in the heart, it causes iotitis. Okay, so one is in the brain and this is in your heart. Okay, that's it. Okay, now I'll make it like this better. Okay, okay, now next. So you know the statistic test here, the screening test, that is non-specific test or screening test. You do VDRL, VDRL. This is sorry, this is, excuse me. So this one is your RPR card, RPR. This is a VDRL. Only thing is that in VDRL you need microscope. Both are precipitation reactions, and I'm not going to talk about that. So here this is a glass slide. So you'll put our antigen antibody and you'll check. Okay, both are just a screening tests only, non-specific screening. Okay, screening test only. For specific test, you have a lot of tests, TPHA, TPI, your FDA, ABS, those things. Those are triple specific. These two just for screening. And only thing is that for prognosis, for PDR is very important for CNS prognosis. Both are good for screening and prognosis. You already see the titer value by using these two, yes. But this is also used for CNS syphilis, neurosyphilis. Very important. Okay. Then here, one more thing is dark field microscopy. In dark field, you can see here, what is this? Again, the field is background is dark, but here you see the spirochetes. See the spirochetes moving. And you know the motility, very important, frequently asked, all spirochetes, but this Treponema pallidum we are talking here, which motility? Corkscrew. Corkscrew motility. Okay, corkscrew motility positive. This is also very important question. Frequently asked, don't forget. Okay, in spirochetes, we have Borrelia, Treponema, BLT, and Leptospira. Okay, three things. So these are things you're going to remember very well. Okay, excuse me. That's all. Now, these are the congenital syphilis. When you talk about congenital syphilis, again, I'm sure congenital syphilis, you must be thorough with this in your pediatrics already, but then okay, it doesn't matter because we are in microbiology, you know microbiology also. So you see, these are the snuffles we call rhinitis, no? That is a snuffles, nose. You see this notched Hutchinson teeth. Hutchinson teeth, because that is the notched incisor. Notched incisor. The first one, notched Hutchinson tooth or teeth. Here you see the saddle nose of this baby. Yeah. And this, saber shins or tibia. Saber shins or tibia. Looks like a blade. It looks like a blade. No, that is also syphilis common. One more thing which you can add is the we call it as the Argyll-Robertson pupil also. Okay, we forgot about Argyll-Robertson pupil also, important for congenital syphilis. Okay, Argyll prostitute pupil. Prostitute pupil. Here simple how to remember. AR means accommodation reflex. Accommodation reflex positive, and there is no light. Light reflex negative. These, prostitutes, they don't have light, but they can accommodate the people. Something like that. Okay, for to remember. Okay, so Hutchinson, Argyll Robertson is characteristic for syphilis. Okay, that's it. This is my part. Now we're going to another diseases. So syphilis was number. One second, I'm just going to see the number. It was 65. Yes, 65. Now we're going to 66. Next one, 66. Yes. Now here you see this one very genital ulcer plus you see the buboes. This is true lymph node. Okay, bubo means typical lymph node positive. Whenever bubo, I always say when this word bubo comes, you remember it's a bun. Bun. Okay. Bun. This girl. Okay. Bun, gravy, fry. For everything, this girl Eti uses which product? LG product. She uses LG product. She likes LG stove. LG stove to cook all these things. She doesn't use Philips or any other thing. She use only the LG stove. So why I'm saying all these things? Because first of all, LG, because this is caused by lymphogranuloma venereum. That is Chlamydia trachomatis type L1, L2, L3, the causative agent, number one. Why say ethi? The condition, the stitches formed are called ethiomyine. It's very typical lesion where there will be stitches between the lymph node and the ulcer. There is a lot of stitches, ethiomyine. Bun because bubo, we call it as bubo. Gravy, there's a sign called groove sign. Between these two, you'll see a sign called groove sign. Gravy, groove. Okay, and free because freeze test. You do freeze type 4 hypersensitivity reaction. They can ask you question on that also. Fourth hypersensitivity reaction. That's all. This is for your lymphogranuloma venereum. Okay, and of course the bubo is painful, not the ulcer. Bubo is painful. This will be only the lymph node will be painful. That's what we call lymphogranuloma venereum. No, LL. So L is painful here. That's all. Okay. Yes. Now in this question, next one. If you see here, this is again, it can be any ulcer. So this, let's make the question like this. 67, 66. Let's make the question like this. Painful ulcer. Okay. And then this picture was given. What you're seeing, see here, tram track appearance. Continuous big tram track appearance. Painful ulcer with tram track appearance. If the question comes like this, painful ulcer, tram track appearance comes, all you have to remember is which one? Your Haemophilus ducrei. Ducrei. Cry. So cry means it is painful, no? Painful ulcer. Cry means the ulcer is painful. And the ducts are soft, no? Ducts are soft. So you call it a soft chancre. You call it a soft chancre. Okay, very important. And you see the ducts. They are going on a tram track or railway track. Okay, in the order. So you remember. So the ducts are going in track. Ducts on rail track or tram track. Rail track. So do you call it as tram track or rail track appearance? On Gramstein, rail track appearance. All are question. Okay, painful, and the most important is painful, and it is called Haemophilus ducrei. That's it. Okay, these are frequently asked questions. Okay, you can expect all these things. Now this is very, very important. Again, you know this, frequently they'll ask you this question. Here. Okay, this is a little bit I'm sorry, the picture has got hidden inside. It's okay. This is basically, this, if you guess, this is usually in vaginal. This is coming from the vaginal discharge. Patient is having vaginal discharge, and then they did this cell like this. So basically this is clue cells. Okay, called clue cells. What's a clue cell? Clue cell is basically an epithelial cell. Epithelial cell margin is distorted by epithelial cell margin which is distorted by the bacilli, lot of bacilli. That's it. Okay, so you don't see the epithelial cell clearly. The margin is distorted by the bacilli. That's it. That's the clue cell. So you put it in the two scores, Nugent score. You know that Nugent score and the Amsler's criteria. We have two scores, Amsler's criteria. So in Amsler's criteria is clinical, Nugent is a Gramstein criteria. We're not going in detail all those things. The idea is, remember, clue cells is here, and in bacterial vaginosis, causative agent is, you know that Gardnerella vaginalis is caused by Gardnerella and Mobiluncus. Mobiluncus. Okay, yes. And then main thing here in this bacterial vaginosis, the disease is bacterial BV. We call BV, bacterial vaginosis. Very, very important. Bacterial vaginosis. So in bacterial vaginosis, you will be seeing the clue cells, number one. And then apart from that, it's a fishy order. When you add you remember, we have a whiff test. Whiff test. Whiff test. Whiff test is basically when you add 10% KOH. When you add the 10% KOH to the discharge, they'll have what fishy order will be there. The discharge will have fishy order. That's the important point. Important. Okay. That is also one of the thing in your Nugent's criteria. So remember that. Okay. That's very important. Yes. Now we're going to another very, very important. Almost if you're coming to the ending parts, important pictures. So this is few culture media. You see here. green color, and with this type of colony, yellow color colony comes, that is basically your TCBS. TCBS agar, that is thiosulfate citrate bile salt agar, very characteristic for, and wait, let's finish this. Another sort of green color, but you see black color colony, that is bile salt agar. Excuse me. Now both are important for, excuse me, both are important for who? Vibrio cholera. Vibrio cholera, the darting motility, rice water stool. Like two important points you never forget is in Vibrio cholera, darling viva, darting motility or shooting star. You know the darting or shooting star. Viva is a darling and she's a star. You see from the previous lectures, I made clue for you. Another thing is rice water. The rice water stool, rice water diarrhea, rice water stool. Okay, that is Vibha story. Vibha story. You can check in my previous revision classes. You can check. Okay, darting. So darting motility, rice water stool is one thing. This is a selective media. These two are the selective medias. Selective media. Thiosulfate citrate bile salt agar. Okay. Right. Now, this is for Vibrio cholerae. Now, next one. This is also another important test. This is also string test. We have string test or intro test in Giardia. You remember Giardia, not only Giardia, Cryptosporidium, strongness. I'm not talking that another. That another important strings is you mix it with a bile. When you mix the Vibrio with a bile, you will get a string like this. So positive. So Vibha, what happens? She puts a string around her neck. Remember, like Vibha, she puts a string around her neck. So again, Vibrio cholera. Vibrio cholerae. One of the important tests for Vibrio. Okay, now next. These are two commonly asked medias. You see, this is a McConkey agar. This we finished the Vibha 70, 71. Now McConkey agar. In McConkey agar, you know that when it is pink color, this is McConkey and this is clad media. Clad agar. Okay. Clad is basically cysteine, lactose, electrolyte deficient. Okay, basically we use clad to inhibit the swarming motility, inhibit the swarming of Proteus. You know, swarming means Proteus is the main culprit. So you get what? You inhibit this thing. So you usually use for UTI, urine sample. For urine sample, we use this clad agar. Okay, that's one point. McConkey agar, you know. So it can be, if it's pink color means it is lactose fermenter. Lactose fermenter. This is, if it is yellow, then it is non-lactose fermenter. Non-lactose fermenter. Okay, that's it. That's the idea. And of course, there in McConkey, if you remember, yeah, they might ask. See, the shortcut is plant in McConkey. P for daspeptone, L for lactose, A for agar, T for taurocolate, basically bile salt. N is important. Thus, the indicator here is neutral red. Okay, neutral red. So that can be one question they can ask you. So the little bit, we'll just, go through it. That's all. Now, next question is very, very everyone's favorite, and I know. This is diphtheria. Which one? Our Corynebacterium diphtheria or diphtheria. Now you know everything very well. I'm going very fast. You see, first of all, pseudomembrane. Pseudomembrane is very characteristic for this thing. Pseudomembrane means what? When you try to remove, it will bleed. Bleeding will be positive. First point. Okay, that is very important. Second one, it looks like a parotitis, but it's not parotitis. You call it as what? Bull neck. Bull neck. Bull neck is characteristic for the diphtheria only. Okay, it's like very difficult, So now, next. Two media is important, very, very important media. You must frequently ask. One is the Loeffler's serum slope. Loeffler's serum slope. Diphtheria. Other one is your potassium tellurite agar. Potassium tellurite agar. Okay. Yeah. Now that's what I say. How to remember? Always in the ward, when a diphtheria outbreak is there, tell doctors, junior doctors, tell doctors not to loaf around. Okay. Loaf around in diphtheria. Okay, tell interest not to loaf during diphtheria. That's very, very important. Okay. So now when I say tell, this is because tellurite agar, very easy. Loaf because low flow serum slope. Very simple. So which is fast growth? This is fast. Hef is there, so fast growth. That means you have growth in 6 to 8 hours. You already see the growth, but it's not specific. Here it will take 48 hours, long time, 48 hours. But this is specific, but it's very specific. It's a specific or selective. It is very selective. That is what. Okay, but this is just only to enrich the media, get it fast. Okay, that's all. Now what happened? You see, you are using special stain, Albert stain. This is your Albert stain. You can do a lot of stain, but typically you did Albert stain. You have big list, no plan. You do plan. You can use Ponders, Loefflers, Albert, and the Neezer stain. Shortcut is plan, and you would see in my notes. Okay, but important, and this is a gram stain. It's a gram. So both the places, what you are looking for, you are looking for Chinese letter patterns. Look this Chinese letter. Main thing is this word important, Chinese letter, cuneiform you call cuneiform. Cuneiform pattern you see. Okay, with what? Metachromatic granules, with metachromatic granules, or baby urns metachromatic. The granules is very characteristic only for your diphtheria. Okay, don't forget it. Metachromatic granules, metaprofit, babes earnest, babes earnest, metachromatic, phosphate granule, everything is right. Okay, same way here also. In the gram stain, it will be gram positive. You know, this is comes in the McDonald's. So MACD, D for diphtheria. So in a gram positive one, it's a gram positive bacilli. That's all. Okay, this for diphtheria. One more important thing is that, yes, I'm sorry, the picture has got hidden inside. I can't remove it out. Okay, the idea was here, the one more test called elect gel. Don't forget elect gel precipitation test. This is for, again, to detect the diphtheria toxin. Diphtheria, everything is about toxin. So to detect the diphtheria toxicity, we are using this diphtheria toxin. Okay, that's an important question, not to forget. Okay, good. Elect gel precipitation, of course, Schick test. Schick test is obsolete nowadays. Schick test, but it detects the susceptibility. It detects the susceptibility of the diphtheria. I mean, if it is positive, then it says patient is susceptible to diphtheria. That's it. Okay, Schick test. You know, this is a type, comes under type 3. This is the only one coming in type 3 hypersensitivity reaction. That's all. Finished. Okay. Yes. Now, next one. Yeah, very, very important. The moment you see this picture, you're seeing an acid fast bacilli. So when we're talking about acid fast bacilli, 72. Now, whenever you're seeing an acid fast bacilli, automatically in your mind, what should come in your mind? Acid fast bacilli. You're talking about Mycobacterium tuberculosis. We are talking about what? Mycobacterium tuberculosis. So this is basically Mycobacterium TB. So you know that here beaded appearance, pink color, all this pink color beaded appearance, that is the acid fast bacilli. So main thing here, carbol function is a primary stain, but H2SO4 you used how much? 25%. Very, very important, 20%. You know the 5% one, 5% means 5. So LEPRA, you have 5 letters. So that is basically Mycobacterium leprae. 1% we already spoke already. 1% for you already read to all the acid fast parasites, your crypto, cyclo, iso, from a few of Tinea saginata segments, hooklets of the hookworm, all those things and all. But still, the hooklets of your Tinea saginata and everything will come there. But here important is your nocardia. Nocardia also 1%. Of course, 0.5% usually for spores and sperms. Spores, yes, it looks like yes, spores and sperms. That's okay. That's a repeated question. Not going to talk here. Yes. So this is how it looks like. Okay. Now, what about this here? Here, what you're seeing is an LJ media, Lowenstein-Jensen's media, rough, tough, buff colony. You already know that rough, tough, buff colony. So I'm not going to talk about it. So these are even not even, this is more medicine related. So anyway, you see this one, this is a primary TB because why I say primary TB? Because you can see the lesion is on the lower lobe, upper segment, lower lobes, upper segment. Okay, lower lobes, upper segment, primary TB. Whereas secondary TB, you see in secondary TB, it is usually present at the secondary TB is located where? It's located at the upper lobes, apical part, upper lobes, apical segment. It's present in the upper lobes, apical segment, apex. Okay, like ulta. That's all. Okay. Yeah. And this is your Miller TB. It's see everywhere it's spreaded widely because it's an HIV patient. You will get what? Miller tuberculosis. Okay. This is another one. More you'll just studied in medicine more and pediatrics also. This is a collar stud abscess. This is a collar stud abscess by TB. Collar stud abscess. If they ask what is causing TB, it's a cold abscess. You can sometimes people call cold abscess also. That's also right. Scrofloderma also right. If you say scrofloderma, that is also right. They all related to TB only, microbiome tuberculosis. Okay. Now here, when you see multiple constrictions here and there, you see multiple constrictions. So when you see multiple constriction genital tract, that is again goes to TB. Fallopian tube or whatever, which leads to infertility. Okay, so this is again regarding the tuberculosis. Now, yeah, this is again very interesting one. This is your leprosy. In leprosy, that is Mycobacterium leprae. So this is your TT form, TT, and this is your lepromatous form, LL form. Okay, very important. So TT only you see the skin changes. That is this basically paucibacillary. Here multi-base. That's what it is. Very severe. Multi-bacillary. So typical you have that typical nodules. Nodules you will see here. Just only the skin changes, pigmentation. Just the pigmentation things. Okay. But here important. Remember in TT immunity is high. Here immunity is low. That is what happened. Your lepromin test will be positive here. Lepromin will be positive here, but it will be negative here. That's it. One small difference that you have to remember. Okay, that's all. Now look at this picture. So when you see the leprosy, Mycobacterium leprae, when you use a 5%, which is called fight for upper technique, also sometimes they call, when you do it, you see typical what appearance? Again, this is you call it as globe or cigar appearance. So cigar bundle appearance, cigar bundle. Remember, TB people, what? They are poor. So they, sorry, leprosy people are poor. When they're thrown out of the village, they eat, depend on this kacha gobi, and the raw gobis and cigar. These are things they have to eat. No other option. Okay, something like that. Remember like that. Okay. Now, this is the nine-banded armadillo. This is for usually Mycobacterium leprae. No artificial cultured media. No artificial cultured media for leprae. Okay, so we have to go animal. In animal, you can grow. In animal model, which one? In animal model, we can grow it in the nine-banded armadillo. That's important question. Nine-banded armadillo or foot pad of mice or foot pad of mice. Question. Okay, so this picture they can which one go? It's for of course Mycobacterium leprae. It's for leprae. Yes. Now for the Clostridium. This is for the Clostridium. These are Clostridium spores. You see terminal. Okay, I'm going to write it here. Clostridium spores. Usually, this is how it looks. Terminal or central. Let's think. Terminal. Again, two things. You have Clostridium tetani and Clostridium for TT. No, tertium. They can give any picture. So tetani is like a drumstick. Always say to drum. Tek, 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 drum. Okay, drumstick appearance. You know, it's drumstick. With a drumstick, you do what? Tet, 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 tetani. But with tertium, there's R for racket. Tennis racket appearance. Tennis racket appearance. Okay, that's it. But central, the spores are not that important, but it's called Clostridium. We call it as Clostridium perfringens. Clostridium, sorry, bifermentis. Mentis. Subterminal, most other Clostridiums are coming into this category. Your perfringes, botulinum, etc., they are subterminal. Okay, that's it. Yes. Now, this is the typical Clostridium tetani. This is your Clostridium tetani, how it looks like. So when you write the Clostridium tetani, when you talk about the Clostridium tetani, so I'm going to write it here now. Yes. This is your Clostridium tetani. Face, you can see this is the rhizos. These two faces you can see. Lockjaw, rhizos, sardonicus, Lockjaw. So many names, no? Lockjaw, Rhizosardonicus, Devil's Grin, all these things. Okay, these are the few names for this. And the baby, you look, this is typical opistotonus position for tetanus, typical for children. Okay, you know that what I'm going to say. Basically, it inhibits the GABA and glycine. Frequently asked question: GABA and glycine. That's the reason. Okay, yeah. And this is a Clostridium tetani. Look at this picture. This is a floppy baby syndrome. The baby is flaccid, no? Flaccid. There it is spastic. Here it is flaccid, floppy baby. So flaccid paralysis means you know that it is actually your Clostridium botulinum. Clostridium botulinum. That's all. Very, very simple question. Okay, and because of honey. Honey in the spores due to infant botulinum. Adult, it's the bottled or canned, peas, any food, peas or beans or whatever. Okay, that's very easy. You know that one. I don't go too much. Now this is the media. Basically, this is again hidden. This is actually Robertson cooked meat media. Robertson cooked meat media. So this is another important one. This is basically for all the anaerobes. Anaerobes means for Clostridium or actinomyces. You can use this actinomyces. Robertson cooked media is for anaerobes. Okay, that is one thing, one point you remember. Yes. Now, yes, this is very, very important. This because I draw this picture, I always say the students remember to make it easy. If this is Mr. Perfect, Mr. Perfect Naga, Mr. Perfect Nagarjun. Okay, Nagarjun. It's a bit crazy man, no? So we are going to put, why did you say Mr. Perfect? Because this is Clostridium perfringens. Perfringens, okay, Clostridium perfringens, otherwise called Welchii, okay. Nagarjun, because the reaction name is Nagler's, repeatedly asked question. Nagler's reaction, not the Naegleria fowleria, Nigel, that's different one, don't mix with that. That's different Naegleria, here Nagler's reaction. So, lot of things are here. One, you see, Nagarjun's favorite is cars. So, boxcar appearance. Boxcar, gram stain, boxcar appearance means you just about your Clostridium perfringens. First question. Second one, he has a lecithin gun because this is lecithinase is the main, that's the alpha toxin, which is the main culprit here. Okay, alpha toxin. Now, what does it do? This toxin, you see this picture, it causes a special lesion called target lesion. He always has a target. So not target lesion is Lyme's disease, target hemolysis. Double zone hemolysis we call double zone. You see two zones here. Okay, you'll see two zones, first zone and second zone. That's what we call it as a target hemolysis. So who has a target? Our perfect Mr. Perfect Nagarjun has. Okay, and here this is a reverse camp. Actually, the picture is missed. Basically, what happened? You're going to put like this. Like this, you're putting, and you'll get an arrow here, two streaks. So here in the center, you're going to put a Clostridium perfringens streak. On the side, you're going to put in the group B streptococci. Agalati. Basically, you're going to put agalati. Then you'll see the arrow. That's called reverse camp. So I always say our Nagarjuna is little bit ulta. Everything he does ulta. So reverse camp. Reverse camp test positive. I'm sorry, the picture is hidden inside. It didn't come out. I don't know, some problem. That's okay. Doesn't matter. And here, this is the Naegler's reaction, which I'm talking Naegler's reaction to detect the toxin. It's a type of neutralization. N for N, neutralization. N for N, Naegler's. Neutralization of toxin, antitoxin. Okay, neutralization test. Also question. Okay, this is another important question. Yes. Box corvitor, and of course the disease is gas gangrene. And what happened in movie set, our Nagarjun got an accident and then he developed gas gangrene. Okay, that's all. This is the road traffic accident. He got gas gangrene. Remember like this, okay? And of course, the spores here, or usually in gas gangrene, you don't see the spore, but if you see, it is club shaped. So Nagarjun is the owner of clubs. Okay, he has scars and he has clubs. That's it, club shaped spores. If they see, that's it. Okay, lecithinase. This I put it because this is a target. He has always a target. So that means target hemolysis. That's it. Okay. And one more thing also, litmus milk. We didn't write, but yeah, you can add it. He drinks litmus milk. It's a little bit complex, it's a little bit crazy, Nagarjun. So he did litmus milk fermentation. Litmus milk fermentation also caused by this Clostridium perfringens. I'm going only the reactions, only the pictures. So I'm going here. Here is, oh yeah, this is our beautiful one. So whenever you see this girl Andrea, Very simple. When I say Andrea and this is a Maddie. Andrea because it is anthrax. Okay. Andrea sounds anthrax. Anthrax, Bacillus anthrax. Okay. B anthrax or Bacillus anthrax. And Maddie because there is only one reaction only for this thing, that is which reaction? McFadden. McFadden's reaction, that is only for anthrax, Bacillus anthrax. So first thing, Andrea Weissef, see leather, animal related. And this girl, you can draw a lot of things here. First of all, she is having pearls. You look at her hair, Medusa head hair, and then she's holding a bamboo stick, and then other hand she's holding a Christmas tree, Christmas tree. That's all. These are favorite. So what I want to say, and then of course the characteristic lesion in Bacillus anthrax is because it's animal wool sutter, or other one is your Harry Potter wool sutter. Doesn't matter. Okay. So what is the basic? Just use an eschar. Just an eschar painless. Usually eschar is a painless. It's a malignant pustule. It looks like sounds crazy, but it's not dangerous. Malignant pustule. You call it as malignant pustule. Okay. Now, here, what are things you should see? I told she wears her hair is like this. Andrea's hair is like a Medusa. So this is the Medusa head colony. Medusa head colony. Other one is a pearl-like reaction. Pearl-like reaction. All are question. Either pearl, Medusa head colony. This is a McFadden's reaction, which is positive. And he's a cool Maddie. He's a cool Maddie. Okay, I'll tell you why it's cool. He's cool. And then this is the bamboo stick. That's what I'm saying. This is a question. Bamboo stick appearance on gram stain. Car is for Nagler, bamboo stick is for here. And this is the typical your inverted fir tree. Inverted Christmas tree or fir tree. Inverted fir tree appearance. Okay, question. This is a Ascoli. When I said cool, Maddie is cool. Cool, no? Cool. Ascoli, thermoprecipitation. Thermoprecipitation reaction, thermoprecipitation, all for Andrea. So all for Andrea anthrax. Very, very simple and easy to remember. Okay. Nothing complicated. Very, very easy. Yes. Now one more thing here. Very, very important is this is your Haemophilus influenzae. What is the typical thing you're seeing here? Satellitism. Okay, you're sticking the staph aureus in the center. The staph aureus will provide nutrition. That is, Haemophilus means it needs the X and V factors. No, so staph aureus is producing. So when it's producing, you see only around the staph aureus, the colony is very high around, but less later on go less. So that is typical called satellitism only for your Haemophilus influenza. Very important question, don't forget. Okay, repeatedly asked. Then here typical, what you see, epiglottitis, that's also Haemophilus influenza. Epiglottitis, what is the sign name? We call it as the thumbprint appearance. Okay, thumbprint appearance. That's all. Okay. So this is another important question they can ask in this one. Okay, that's all. Very, very easy. You remember it. And here, this is a fried egg colony. This is a fried egg colony, how it looks like. So fried egg colony means itself, you know what I'm talking. This is basically for your mycoplasma. Mycoplasma, right? Mycoplasma. Eaten agar PPLO agar, because PPLO pneumonia also, whatever you want. This is an antibiotic susceptibility testing, antibiotic disc test, which is also called as Kirby-Boyer disc method. Called as Kirby-Boyer disc diffusion method, disc diffusion test. Kirby-Boyer disc diffusion test. Okay, that's it. This is the Staphylococcus. Whenever I say Staphylococcus, remember a staff. A staff has two important things. What is that? One thing, catalase positive. Very, very important. Catalase is positive. Second one, they love grape because grape-like cluster. Remember, grape-like cluster. Grape-like cluster. Gram positive cocci, GPC. This is how they look. Exactly. This is the one. Okay. So this is a gram positive cocci in cluster. This picture will come many times. They'll give you a case history and they'll give that picture to identify. So don't make any mistake in that question. Okay. And this is your catalase test. This is your coagulase test. Coagulase, nothing. Just you see this coagulum is formed. That's it. Okay. Here in catalase, you see the effervescences, bubbles. Bubbles you see when you add to the colony 3% H2O. 3% hydrogen peroxide. Okay, that's it. Now, this is a pinhead. Always I say staff head, head staff. No, I always say head staff. Why I say head staff? Because the colony is typical pinhead colonies. Pinhead colonies. Pinhead colonies. Okay, with beta hemorrhage, pinhead colonies. Characteristic for your Staphylococcus aureus. Okay, yes. And then this is the pigment. So this is a golden yellow, golden pigment. Staphylococcus aureus produce golden yellow pigment. Pigment. Golden yellow pigment means you'll think about Staphylococcus aureus. Very, very easy and simple. Aureus means it's of gold. So again, this is a mannitol salt agar. Same, doesn't matter. I'm not going to write all this. It's a nutrient agar, mannitol salt. Everywhere you see the pigment, golden yellow pigment. This is also recent because of mannitol fermentation. That's okay. I added it. These are all the lessons of your Staphylococcus aureus. Stafford, this is a more derma question. So you can see all the lesions: carbuncle, furuncle, carbuncle, folliculitis. This is your impetigo, and then this is a Staphylococcus scalded skin syndrome. Very good prognosis. You can see the skin's peeling and all. That's because of that epidermolytic or exfoliative, we call it the same exfoliative toxin. So this picture, we have other toxins also, but now for picture, this is important. Staphylococcus toxins. Okay. And then this is one of the, it looks like aspergilloma, but there is condition pneumatocele. Your Staphylococcus aureus pneumatocele. That's important. Now when we talk about the hemolysis picture, this is the beta hemolysis, complete hemolysis. This is alpha, this is gamma. Beta, always I say beta, if you have money, beta, you are complete. Okay. Beta, if you have beta, that is equal to beta's money beta. Okay. And I don't know how you say, but we in South, we say beta, he has a lot of beta means he has a lot of money. So complete. Beta means complete hemolysis. Alpha is partial. Gamma is no hemolysis. And for complete hemolysis, two examples. That is, write it here. Group A, that is Streptococcus pyogenes. And group B, that is your Streptococcus agalactiae, right? Yes. Alpha, only two things. Streptococcus viru, our viru is partial guy, viridans. And other one is your Streptococcus pneumoniae. Okay. And here, Enterococcus. Nothing is there means Enterococcus. Sometimes they say Enterococcus can be alpha, beta, or gamma also, but mostly it is gamma. Okay. That's it. Okay, now any streptococcus, it will look like this. Any streptococcus, all streptococcus, how they are cocci in chain. Cocci in grape-like cluster is staff, but in cocci in chains means it is always this gram-positive cocci. In chains means it is always the streptococcus. Strep means chain, so that's important. Here, you see here, it is a pinpoint colony. Their pinhead is staphylococcus, but here you see pinpoint colonies. So that is for streptococcus. Pinpoint colony. I'm sorry, this should be pinpoint. Okay. Pinpoint colony. Very, very characteristic here. Okay. That's also, excuse me. And this is Streptococcus pyogenes. When you talk about Streptococcus pyogenes, that is group A. There's a group A Streptococcus. You see characteristic. What is this? Pharyngitis, acute pharyngitis. Which causes true membrane. We don't membrane here, but true membrane causes of tonsillitis, acute pharyngitis, most common cause. This is your cellulitis. Most common diabetic patient, DM patient is very common. This is necrotizing fasciitis. Necrotizing fasciitis. Okay, that's all. So, this is a camp test. This is a true camp set. Reverse camp, that's what is two things are there. One is your reverse camp and true camp. In true camp, what happened? The central part here, this is your Staph aureus. And then the side one which you have put it, this one, that is your group B, Streptococcus agalactiae. Agalactiae, okay? Agalactiae. Okay, the boys go, B for boys. Boys do what? Boys do camping. Real camping, okay? Boys do real camping. Remember like that, okay? So this is for This is for which bacteria? Group B. This is to check. So you see a arrow here, that means positive. Group B Staphylococcus positive. In reverse camp, what happened? Instead of Staphylococcus aureus line, you are going to put Clostridium perfringens. Okay, but your diagnosis for Clostridium perfringens only. And then here, same thing. In the side one, it's always the group B only. You're putting the group. You're going to put group B Streptococcus agalactiae. Same one only. Group B agalactiae. That's it. Okay. This is the difference. So this is for Clostridium Mr. That's what Mr. Nagarjun, Mr. Perfect is reverse. But normal boys, they do camping. P for boys. I say Agartala boys, Agalactia Agartala boys. You remember how you want. Boys like camping. Their Clostridium Perfringens, Mr. Perfect do Ulta. That's it. Okay. Ulta camping. So this one question sure expected. This is again typical your lanceolate. If you see here, it's like this, no? Capsule with lanceolate. So when this lanceolate diplococci, gram-positive diplococci comes, you have to remember Streptococcus pyogenes. Streptococcus pneumoniae. Pneumonia means lung only. Even if you forgot, the lung also like this, just somewhat it looks like a lungs only, the shape is looking like a lungs only. So Streptococcus pneumoniae with a capsule, of course, they have a typical capsule. Okay, with capsule. Very important is the capsule. So here, Streptococcus pneumonia, I always say to remember bio group, bio, because bile solubility positive and inulin fermentation positive, inulin positive, and optogene sensitivity also positive. Okay, three things positive. Yes, but anyway, picture what you're seeing a carom coin. You see carom coin. Carom coin, if you see, then carom coin or they call it as Draughtsman colony. Very frequently asked question, DRA Draughtsman colony. Carom coin or Draughtsman's colony. Carom coin or Draughtsman colony means Streptococcus pneumoniae. Important question. Okay. This is the bile. This is this is your bile esculin. Black color, no? So this is called bile esculin test positive. Bile esculin positive means that is your enterococcus. Enterococcus. Okay, that's all. Very, very simple and easy. So this is a typical that Lyme's disease, which we call it as Lyme's disease. The disease name is called target lesion or bullseye, bullseye, but characteristic erythema migrans. We call it erythema migrants. Okay, that's all. Very, very simple and easy. Okay, and here you have to say this is a ghee broth. In ghee broth, if you're seeing this stalactite growth, this is called stalactite. Okay, very important question. You see the stalactite growth. Stalactite growth is basically in the winter snow in the front of the houses. When there is snow, you see something hanging in front of the house. That is the stalactite growth. This is very, very characteristic for Yersinia pestis, the plague. And also, so ghee, everything comes, you think about Yersinia pestis. Okay, and special stain you do here is Wason stain. Wason, here also there is an Y, Wason stain. You see typical, what you see? Typical safety pin appearance. Safety pin appearance, okay? Bipolar safety pin. This is the typical, what you call the plague, which is septicemic. Septicemic plague, already it's very dangerous, which is gangrene, that leads to the Black Death. That's all for the plague. Okay. Yes, almost done. So this is an again silver special stain, what we call Warthin starry stain, Warthin starry silver stain. This is basically for which one? For our stomach, that is your H. pylori. Warthin's, that's what this black one, what you're seeing is the H. pylori, Warthin starry, silver stain. Okay, silver stain. So this is a seagull. You see, it's looking like this. This one here, the baseline is looking like a seagull. Seagull, where you see always, you see a lot of seagull when you're doing camping. So the seagull appearance somewhere with food poisoning, etc. comes, you think about Campylobacter jejuni. Campylobacter Jejuni, Campylobacter jejuni. Okay, that's all. This is one question. Easy, very, very simple. Okay. Now, look at this one. Here, again, intracellular, you see sort of lentil shaped. Uh, lentils, lens shaped, you can say whatever, lens shaped diplococci in CSF. Usually it will be CSF or blood, doesn't matter. Okay. Gram, again, this is a gram negative. All a gram negative diplococci, then that is your Neisseria meningitidis. Meningitis. Okay, meningitis. You know this one very well. So this is the purpura fulminans, the characteristic meningococcemia. You have meningococcemia. You see this purpura fulminans because of the septicemia. Okay, this is also for Neisseria meningitis only. Okay, Neisseria meningitis. Same one. Again, Neisseria, but you see intracellular and again pus cell, but the shape is more like this. The shape is more like a beans, kidney bean, like a bean shaped diplococci. So like this. Okay, kidney or bean, diplococci, if you see, then that is your cat. And usually in the history, you will have a discharge, urethral discharge. So that is, looks like G, no? So gonococci, gonococci. This is Neisseria gonorrhea. Basically, it's called Neisseria gonorrhea. Okay, this you know very well. Basically, what you have urethral this discharge, you'll see flow of seed, urethral discharge. Very, very important. Okay, that's all. Now, this one, next one is your Klebsiella. This is your Klebsiella pneumoniae. So first of all, it causes very gangrenous, you can see here, it can cause very gangrenous pneumonia. But in alcoholic, usually alcoholic patient, the history will be alcoholics. Okay, this sputum is basically currant jelly sputum. You call it as red currant jelly sputum. Red currant jelly. Characteristic feature. Okay, yes. Next. These are typical noses. This is a woody nose. When I say woody nose, you know very well that is caused by rhino, that is Klebsiella rhinoscleroma. Scleroma means hard nose, scleroma. Scleroma. So scleroma is hard, so it is woody. Here, this is called roomy nose. A roomy nose is basically you have a lot of space inside. So this is caused by Klebsiella. Which one? Atrophia. Okay, atrophia. Atrophica, whatever it is. Okay, atrophica. Okay, atrophica. Okay, Clostridium. This is sorry. Once again, another name, but I like the main name. Okay, but the main name you will call it as Klebsiella ozianae. Klebsiella ozianae, but that is again it's an atrophic rhinitis. Basically, it causes atrophic. So you call it as atrophius also. Atrophic. It causes atrophic rhinitis. So that's what roomy nose, or one more thing they call it as merciful insomnia. Merciful insomnia. And here in woody nose, of course, you're going to see the Mikulicz cell, Mikulicz and Russell cell. Mikulicz and Russell cells. Very, very important. Okay, commonly seen. This you know very well. So this is a beefy ulcer. A beefy genital ulcer means beefy ulcer means the one word question, one liner they can ask you. That is your donovanosis. Donovanosis. Again, this is caused by Klebsiella. That is your Klebsiella granulomatous. Klebsiella granulomatous. Very, very important question. Okay. Yes, the same thing. This also has a safety pin appearance. Safety pin. This granulomatous have safety pin appearance. That's it. Okay. So these are few important. This is now almost we are coming to end part now. This is a Proteus. For Proteus, important is swarming motility. And this girl Proteus that I'm not going to talk about those. You'll see in my picture. Prochita, she likes swimming. So swarming. Remember like that, swarming. Swarming motility. This is urease, very characteristic. Urease test is positive. And because of that, what happened? One of the important thing what you see here is the alkaline phosphate stone, which is also called the staghorn. Staghorn stone. Okay, staghorn stone, alkaline phosphatase stone, because it happens in alkaline, so it's caused by protease. That's what important. Okay, yes, this Ekta Kapoor story is very important because this condition is called ecthyma. So ecta, let's make ecta because this condition is ecthyma gangrenosum, and she's colorful, so everything is colorful here. Ecta Kapoor is colorful, so that's the first reason this lesion is called ecthyma gangrenosum. Now look at this. What else? You know that Ekta Kapoor is piercing a lot of ears. So definitely, what is this? Malignant otitis externa. Malignant otitis externa. It's called also very dangerous one, very severe one. Diabetic mellitus patient. Frequently asked question. Diabetic mellitus patient. Very painful. Malignant otitis externa occurs. What is that? This is all I'm saying. About which bacteria? About only 1 hour. Very important one. Pseudomonas. So Ekta Kapoor means Pseudomonas. Pseudomonas aeruginosa. Okay, Pseudomonas aeruginosa. So very, very easy. So this you get green color. You get green color pigment in Pseudomonas only. Golden aureus in Staph aureus. Red in Serratia. Green pigment in Pseudomonas. Also, this means Pseudomonas. No, the other disease, most common because the burns, Shanghai fever, swimmers here, a lot of things comes here, but then these are like now for important. Okay, yes, now we are very, very few things left now. Yes, this is now Bordetella pertussis. Bordetella pertussis. So always remember pertussis. In boarding school kids, okay, mainly in boarding school kids, what they do when they get flu, okay, in the boarding school, if the child gets child gets what they do, they give lot of colors to paint. So basically, I mean to say, with the colors, what they do, thumbprint. In gram stain, if you get thumbprint appearance, that's it. Thumbprint appearance. Okay, this is one question. Other one, these kids, they play with the pearls. So in culture media, especially the media name is called Regan culture media. So you will be getting again, pearl is for Andrea anthrax, but another pearl is this bisected pearl is for children's. Bisected pearls, sometimes you call aluminum painting. Children sometimes play with aluminum mercury also, remember. Mercury paint appearance. The shine is look like in a mercury drop. This is aluminum paint or mercury drop. Aluminum paint or mercury drop appearance. Okay. So these are the names and that's the question you'll be expecting. These are all caused by Bordetella pertussis oophing cough. That's all. Okay. Very, very simple and easy. You know that this is a biphasic media for blood agar. We call it as Castaneda. Usually we go for Brucella, but if you suspect any sepsis. So the blood culture, you can put it here. Blood culture, you can put it in the biphasic media, which is called Castaneda. Okay, that's the thing I did. This is biphasic. So you see a liquid media and you see a solid media. That's all very, very simple. In bacterial growth curve, you know this curve on the line for identify. So mainly in end of the lag phase, the size increase. You know that size increase. In exponential phase, the size decrease, but there will be replication. The bacteria replicates. So that's what happened. Exponential phase, you can do biochemicals test and gram stain. Biochemical and gram stain best in the exponential phase. Okay, that's log phase. Exponential is basically log phase. Gram stain. So here the size will decrease actually. So replicate means what? Bacteria size will decrease. Here lag phase size increase. In stationary phase, the shortcut is there STA. T they make it B. So you know spores formation, toxin antitoxin reaction, toxin and antitoxin reaction, your antibiotics and bacteriocin, all production happens in stationary phase. Star. Okay, very important questions. This all can be asked. And death may nothing. Okay, nothing to remember there. Okay. Now this picture, what you're seeing is an autoclave. Autoclave. Okay, typical autoclave. This is a chamber where you put all things inside. You know the temperature already, 121 degrees Celsius, 15 minutes and 15 pressure. PSC, Pascal, 15 pressure. This is all you know. I'm not going to stress again. Just for the picture purpose, I'm writing here. And this one, what you see, this is an anaerobic jar. Anaerobic jar. Macintosh or anaerobic? Macintosh or anaerobic jar. Basically, with this, what you do for anaerobic environment, this is what you see is gas pack. All to create what? An anaerobic environment. Anaerobic environment. Question. Okay, they can expect this. So this is a typical electron microscope. They can ask you what is looking so huge. So it's a big vacuum is there. You see the vacuum inside, and then you will be getting this thing. Okay. You see the vacuum. That is the main thing here. Okay. So you will be getting it. So basically, electron microscope, you know everything. Only thing is that electron is the source of light here. That is from the tungsten filament. Here, no light, no. So we're using electron only, tungsten filament. And another thing important, you're using the metallic glass, the metal slide. Okay, you're using metal slides. Important. And the fixative, you're using glutaraldehyde as a fixative, and the resins compound to fix the slide. That's all. These are the things. You're not using the glass, glutaraldehyde fixative, and resins to fix the slide. That's all. This smear. That's it. This much only. So these are the most commonly you can expect pictures in the micro. More than enough. And with your revision, you will do very, very well. So all the best once again for all the doctors, especially FMG going soon next month. And then for NEET PG students also. We'll catch up with more important classes and more important questions soon. So all the best once again.